Okay, thank you, the Sergeant at Arm. May I welcome Waziri and the CEO to this session, and good evening, Waziri.
Good evening.
Now, I will take you through the introductory session, and I'm Honorable Benjamin Matata Kirich. I'm the chairman for the ADHOC committee.
I am Sarah Mutual, Vice Chair.
Isaiah Minor, member.
I'm Honorable John Bitok, member.
Beth Richard, member.
Keter Julius, member.
Itzak Mosbey, member.
Silas Som, member.
Professor Kuto, member.
Lucy Tolalei, member.
Jepto Lydia, member.
Tarbey Josephat, member.
Silas Kogo, member.
Beth Kipto, member.
Thank you, honorable members. Let us have the secretariat introduce themselves.
My name is Sang Elliot, member of the Secretariat of the ADHOC Committee.
I am Kipta Boniface, Secretariat.
I am Kiru Justice, part of the Secretariat.
Thank you. May I invite Waziri and the CEO to introduce themselves.
To the honorable members of the House, my name is Ruth Koech. I'm the CEC in charge of health.
Chair and honorable members, my name is Fred Kiptum Koskei, Chief Officer, Health and Sanitation.
Thank you. I will now direct the Sergeant at Arm to place the CC and the CEO under oath.
I, Ruth Koech, do hereby swear to testify on all matters in question and tell the committee the truth, the whole truth, and nothing but the truth. So help me God.
I, Frederick Tum, do swear to testify on all matters in question and to tell this committee the truth, the whole truth, and nothing but the truth. So help me God.
Thank you, Sergeant at Arm. I will now take Waziri and the CEO to the mandate of the committee. The committee was established with the following mandate. A, to with respect to flagship projects, flag and alleged non-existent projects as spelled out in the implementation committee reports laid on the table of the House on 17th September 2024. 2, 1, investigate whether there was financial impropriety across all the departments. 2, establish whether there was a breach of the Constitution or any other applicable laws by state/public officers in the execution of the projects. 3, investigate whether the laid down procurement processes was followed in the award of tenders. 4, recommend appropriate action to be taken against identified breaches and all responsible parties accountable. B, establish the actual cost of personnel emoluments incurred during financial year 22-23 and 23-24, and circumstances, if any, occasioning violation of Section 107 of the Public Finance Management Act, and whether public funds were irregularly paid for personnel emoluments. C, with respect to the Agricultural and Rural Inclusive Growth Project, NARIC, investigate the following: whether the funds were utilized in a prudent and responsible way. B, beneficiaries and their physical location. C, whether the procurement processes were adhered to. D, with respect to the hire of county machinery and or motor vehicles to as contained in the project implementation committee report laid on the table of the House on 17th September 2024. Establish 1, the circumstances leading to hire of road machinery or motor vehicles. 2, whether the tendering process was adhered to in accordance with the procurement and other applicable laws. 3, the actual work done and locations. 4, the total amount of money paid vis-a-vis the budget allocation. 5, whether there was value for money. And the last mandate is to report to the House on the findings and propose appropriate recommendation. Now, Waziri, there was some requirements that you were requested to submit to this honorable committee, and I will read through as you confirm compliance. 1, the disbursement of pharmaceutical and non-pharmaceuticals from 1st July 2022 to the period ending 30th September 2024.
To the honorable members of the House, yes.
And please, Waziri, use the mic.
Yes, we did.
Thank you. Payment details of pharmaceutical and non-pharmaceutical against the suppliers.
Yes, we did.
Personnel in bracket salary emoluments for the period commencing from July 2022 to the period ending 30th September 2024.
Yes, we did.
Tendered works from the 1st of July 2022 to 30th September 2024.
Yes, we did.
Paid works from 1st July 2022 to the period ending 30th September 2024.
Yes, we did.
6, all paid and unpaid consultancy services from 1st July 2022 to 30th September 2024.
The department did not engage in any vendor consultancy services at that period.
7, county executive resolutions which gave your department go ahead to execute.
Yes, we did.
Okay, Waziri, on that item, on county executive resolutions which gave the department to go ahead to produce, You gave an explanation.
To the honorable members of the House, yes, I did give the explanation. And I did quote my mandate as the CEC in charge of health.
Honorable Chair, the CC is not audible enough.
Oh, I did give the explanation, and I did quote on everything that is been asked for, that is covered under the Constitution, the County Government Act revised in 2018-2012. Health being a devolved function. Thank you. Health being a devolved function under the 4th schedule of the Constitution 2010, which covers the national government doing policy and we implementing in the county government. And we do go under all the processes in the budgeting circle. And I think all honorable members of the House are aware that we are on the 3rd edition of the CIDP, and we follow all the processes, which is all constitutional, that covers us moving from the CIDP, the ADPs, the midterm economic terms, the CFSP, the budget, of which all goes through public participation, and also all must be passed in the executive cabinet, including the budget.
Thank you, Waziri.
And presented.
The 8th item is a quarterly implementation reports submitted to the county treasury from 1st July 2022 to 30th September 2024.
Yes, we did. And as a health department, we have continuous assessments and continuous, some of them are quarterly, and we did submit them in our Annex 4.
Okay. Now, Waziri, further to the submission of documents before the County Assembly ADHOC Committee, there was a letter that was addressed to the Chief Officer, Health and Sanitation, and you are requested to produce the following documents. And the letter reads, it has also been resolved that along with the documents and information, you further submit the documents as follows. 1, Captain Dispensary, BQs, payment certificates, award of the tender letter, completion of certificates, completion certificates. Now, this letter was addressed to the Chief Officer. Can you confirm compliance of the same?
Okay, Honorable Chair, I can confirm that we are still looking for the documents and will submit by Friday. We had, we are all aware about HR issues in the county, so the staff who was handling the file is not in office. So we are still looking for that file.
Bonasio, does it mean when the staff is not in office, the file also is not in office?
The file is in office, but we cannot trace. We are requesting for time so that we can submit.
Chair.
So what is the connection between the staff who is not in office and the file which is in the office?
The staff who was handling okay, this staff who was handling the procurement file is not in office, and we've tried to, you see, every staff has a locker, and when we've checked the locker that stores those documents, they are not available. But we are tracing between our department and Department of Finance. We are liaising. Yes.
Chair,
Yes, Honorable Member.
what is this term that is saying we? And does it mean
The department.
that who is the custodian of the documents in your department? Who is the custodian?
For procurement file, we are the custodians, but when it comes to
Chair, he should clarify we. Who is
We
the custodian? Who is the custodian of the documents?
Honorable
Not we.
Member, please give him time to respond.
Okay, Honorable Chair, we, in this sense, is the Department of Health. When I say we, it's the Department of Health. So I'm saying we are liaising with finance so that we can trace, because some of these documents were
Chair,
audited.
something must be put right, please, Chair.
Yes, Honorable Member.
The entire staff of health department cannot be in charge of records of the department. We seek your indulgence, Chair.
Can you be categorical so that we avoid the back and forth?
I'm requesting, Honorable Chair, that you allow us to still look for this file. We'll submit by Friday. Kind request.
Honorable Chair, I think it's really absurd for the CEO to claim that he's looking for it. Like he's looking for it in, is it lost?
It is not lost. It is within the office. These are projects which were done in, which were awarded in 2018-2019.
Bwana CEO,
Yes.
how big is this office of yours that you cannot trace for files?
In terms of measurements,
Allow me.
from where you had Honorable Chair to that end.
Now, honorable members, let me indulge the CEO and I grant the request that provide the document by Friday at 10.
Thank you, Honorable Chair. And on a light note, let me say this.
There should be
No, I've just ruled, so
Sawa.
you don't
Thank
have
you.
to proceed, please.
Thank you.
On the next issue, we have also a submission. And now we have the second issue on the same letter that was addressed to you. Chemnyogoson Dispensary, scope of work for the 2 phases of renovation done, and payment certificates.
I still request, Honorable Chair, that you allow me, I submit on Friday. It came, we received that letter yesterday.
The letter was wrote and was written on, you received in your end
Yes, yesterday.
on 7th October 2024, and it has been stamped. Hope this is your stamp.
We received it yesterday, Honorable Chair, the one for Chemnyogoson.
But now, Bwana CEO, can you verify if the stamp on that letter is yours?
Honorable, the staff, the stamp is mine, and I received that letter yesterday.
Now, can you justify the reason why the letter was stamped on 7th and you received the same letter yesterday, which was on 8th, and today is on 9th? So, what proof do we have to to believe that you received this letter yesterday, and yet the stamp, you first agreed that you are owning the stamp.
Honorable Chair, I'm an honest man. I received the stamp. I received the letter yesterday in the evening, and it was delivered to the boardroom where we were preparing these documents.
Sure.
So I believe the person who was delivering talked to the secretary, and the secretary stamped and brought to my workstation at that time. That is yesterday. Nonetheless, I commit and that I will submit by Friday. Plus the one for Mokwa, and
Chair.
yes.
Chair.
Yes, Honorable Bett.
This is a House of Records, and you demonstrated that the letter was received on 7. Should the CEO blame us or fail to submit documents based on that disorganized department? That is the disorganization in the department, Chairman. You cannot tell us of a secretary who is not responsible to timely give the documents to the CEO in charge. That is not the problem of this committee, Chair. I see some laxity and non-compliance.
Okay, honorable members, allow me to proceed, and then I will make a ruling based on all the documents that have been requested here.
Chair, I think you should give us a minute, Chair, for because the witness that we are about to interrogate they are in charge they are in charge of the county LD Center, and as you are aware, Chair, all the facilities has been shut down. Just give us a minute for us to a minute of silence in regard to what has just happened for the first time in history, Chair, that all the facilities in Nandi County has been shut down.
Okay, honorable member, let me finish first with the compliance issue, then I will grant the 1 minute of silence to that effect. Now, and we have the third item, Mokwa Dispensary, which is in Kapkangani Ward. BQs, payment certificates, award of tender letter, and completion certificates.
Honorable Chair, the same. I request till Friday.
The fourth issue that was requested from you is for F5, the total amount collected and schedule of disbursement.
I submitted.
5, breakdown of recurrent expenditure for the 2 financial year.
I submitted.
And finally, schedule of disbursement of pharmaceutical and non-pharmaceutical for the 2 financial years in question.
I submitted.
Honorable members and the Secretariat with the team from Health, going by the request by Honorable Keter that is requesting 1 minute of silence. But before I grant that 1 minute of silence, can you clarify further?
Thank you, Chair. You see, as we were still in this process, committee, we received a team from the staff purporting to be from the all county government that the facility has been shut down. We have been receiving also calls that there is no facility which is really working in Nandi County. Remember when we were passing by our referral. It is indeed true. It is locked with a big padlock, Chair, and the witness that we are about to interrogate are the one in charge of the said facilities. Chair.
Chair, maybe I want to inquire from the member.
Yes, Honorable Tarbi.
Normally, a minute of silence is observed when we lose lives. Does it mean due to the shutdown of all the health facilities, have we lost lives in the county?
Chairman.
Yes, let us give Honorable Keter to explain.
Chair, thank you. I know that is a very serious, that is the much I could explain now, Chair, because I know there were some people whom they were in critical condition, some even has been discharged, Chair, and some have been in medication, but all of them now, Chair, I cannot tell where they are. Maybe they have been taken to various hospital or home. So it is not my responsibility to declare those ones that have passed, but the act itself is not friendly, Chair.
Honorable Bet.
Oh, okay, Chairman. Thank you, Chairman. I was still inquiring from my counterpart member because a minute of silence means somebody has passed away. So kindly let us make an inquiries or CC and CO to give us the information about the state of the workers during these striking hours, maybe from yesterday to date, and the state of the patient, so that we will all agree in unison for a minute of silence.
Honorable Bito.
Yeah, maybe I also concur with Honorable Member who has spoken, but at the end of when we finish this session, we can pray for the county, we pray for the patient, and we pray for the progress of the hospital. Prayers.
Okay, so that I will make a conclusive ruling, maybe I will ask the CC with the CO, do we have any data that is showing that due to the current crisis in our county, do we have any data that is showing that we've lost lives?
Maybe through the chair. Before that, I wish the CCA could give us the state of all the health facilities.
No, Honorable Member,
if it is indeed true that
you are jumping the gun, Honorable Member. Let us first give Waziri to give us. Do you have any data to that effect to show that maybe from the happenings today, is there any data that has been captured that we've lost lives?
Thank you so much to the honorable members of the House. I do confirm that our staff went on strike today. They gave us the 7-day notice. We have been in communication with them. And when one of the members says, let's hold a moment of silence, that is one of our biggest fears. I don't think anybody is happy about what has happened. In the last 7 years, when the whole country has been on strike, Nandi County has been an exception and has stayed on the job. And it is in those times when everyone has been on strike, even the union officials were running our critical care services. At this time, we have also had an impact after the Public Service Commission report. The healthcare workforce was affected.
Waziri, so that we don't go into
Yes.
many issues, I will just like to request that you restrict yourselves
to the question.
To the question.
Thank you. As of now, with our leadership that cannot go on strike, I have not received. But there is a potential that lives will be lost. And I am a healthcare worker. I am a mother.
Honorable Chair.
And I don't think any of us want us to lose anyone. But the potential is there. We have seen it happen in other counties. And in the last 7 years, we have not been totally paralyzed. And it is a sad day in Nandi that this has happened. And in spite of all the negotiations that we have tried, it's not that we have not tried. That is where we are, and we will continue to negotiate to get.
So, Waziri, by the time you came into these chambers,
yes,
you don't have any communication that or any data from the personnel that you've said that you are communicating with. That
we have been sitting in the waiting room for about 6 hours, and in the group that we have, I have not received any data.
Okay, what
and
about the CEO?
Hoping not to receive any data.
What about the CEO? Okay. Do you have any data?
Thank you, Honorable
or any
Chair.
information
There is
to
no
that
data.
effect?
There is no data that attributes any death to the ongoing strike. What I can say is this is the lowest moment in our department. This is the lowest moment in Nandi. For staff to go for industrial action, it is disastrous in terms of service delivery. The last thing I can say, Honorable Chair, is that when health staff go for industrial strike, they are not allowed by the Hippocratic Act to leave the patient at the bed and go for industrial action. As we speak, Honorable Chair, the patients who are in ward are still being assisted by some staff. The patients who are in renal are continuing with the dialysis as we speak. Those who are at the stage 2 in labor, they were assisted. So as of now, we have no confirmed death attributed to strike. Thank you.
So, honorable members, maybe before we wind up the session, I will request that who is now in charge of the KCRH here currently?
The MEDSUP, Dr. Tanui, is in charge, and the doctors are not on strike. They never gave us the strike notice. It is the nurses, clinical officers, and other cadres. The KMBDU never issued a strike notice. They are working.
Okay, I will now direct the Sergeant at Arms. Where is the Sergeant at Arms? Can you please move into the KCRH and come back with information relating to the issue that has been discussed? Thank you.
Chair.
So that before honorable members, so that the information will get back into this house, and before we wind up the issue, I think a minute of silence, if there will be any happenings to that effect.
Chair,
we shall observe.
Chair, I only wanted to confirm something. Allow me not to mention the name.
Yes,
Chair,
yes.
But, a patient who was in bed 22 passed away yesterday at around 3. And many more. It's only that, Chair, I'm restricted. Otherwise, I would have mentioned more than 2. So I don't know how.
I think, honorable member, I've ruled that the incidents, as per yesterday, is not affected by what happened today. So let us allow the Sergeant at Arms to just go to the KCRH and do some inquiries to that effect and bring us the information. Yes. So I will now proceed to give Waziri some 2 minutes to give us a brief. And on that brief, Waziri, can you rate yourself in a scale of 1 to 10? how can you rate yourself?
To the honorable members of the House, I don't think it's fair for me to rate myself because it is not me alone who runs the department. I have a whole team that comes behind me, and we have many circumstances that drives the health sector.
Point of order, Honorable Chairman.
Yes.
What is the point of order, Honorable Maina?
Does the CECM sign a performance contract?
Did you sign the performance contract?
Oh, yes, I did.
And you are unable to rate yourself? Or there is no performance indicators?
I do have a performance contract, and it is due to be rated, and that is through the County Secretary's Office and Administration. They should be able to rate me in regards to the same. In regards to the targets of the department, in regards to the indicators, in the implementation of the budget, and all the mandates that are in the department.
Honorable Chairman.
Yes.
Maybe we can help her. What we are just simply asking through the chair is for you to give us what you think, how you feel. That's all. It's not scientific.
Thank you so much. As a health professional, and having served in my second term, I will say Nandi County has come a long ways in the health sector. And I will say that with my experience and what I know, you will always plan for the best.
Waziri, so that we avoid many orders from the honorable members, I think it is prudent that you just restrict yourselves to the question.
Okay.
Because if you go the way you want to go, we shall have a lot of interjections.
Thank you
so much. I just want to request Waziri that in a scale of 1 to 10, even before being rated by the other concerned bodies.
Through the chair.
Yes, Vice Chair.
In performance contract, the way I know it, there is a column for an individual to rate her or himself, and then it is rated also by the head of the department.
Yes.
So what we are asking now is your own individual rating. What, according to you?
Thank you so much. An honest rating that I would give myself is between a 7 and an 8, and I can explain that. Because some of the things that you're supposed to implement is affected by resources available. It is affected by budget.
I think, Waziri, you've answered the question,
Thank
so
you.
proceed with the briefing.
With the
I had requested that you give us a brief.
on my rating.
Not the rating, the department.
On giving a briefing on the department, this is my second term as a CECM in charge of health. And I can say that at the beginning, we did a baseline survey when we came in. I did not have any official handover. And from what I know in service delivery, we have brought services to Nandi that we never had before. We have invested in our human resource for health. I know we are all aware that at the beginning we did not have critical care services. We did not have the blood products that we have today in our blood banks. We are all aware our renal services, dialysis was not working. The more complicated surgical procedures we do today, we were not doing at that time. Our mental health department was not functioning as well as it is functioning today. We did not have a cardiac department where we are able to do echoes and ECGs. We were referring all those patients. The imaging department, we were referring almost everything, but we are able to do that today. Our patient volume has gone up almost 3 times, which shows more services and patient confidence. Our reverse referral, we are able to do more complicated stuff that we were not able to do. Our community health strategy, where we started with 36 units. We now have 152. We know exactly where our gaps are, and we have the potential to increase. We do have a strategic plan. We know what our strengths are. We know what our opportunities are. And it is all going to be implemented based on the resources within our availability.
Thank you, Waziri. Maybe I will pose another question.
Yes.
And you are the head of the department.
Yes.
How do you consider the current happenings at your department?
I will repeat myself to the honorable members of the House. It is a sad day in Nandi today that our staff are striking. And in 7 years, we have not done this. And I will say that we view the department as a multidisciplinary team where we value every sector. And all the departments that have gone from the CEOs, the nurses, the lab technicians, the nutritionists, the clinical officers, is courtesy as a result of the negotiations that we have been trying to do with them, one of the complaints being unpaid salaries. It's a hard time during these economic times. Some of them have loans. We are all human and we do understand the frustrations they're going through. And salaries were paid today, but we still have those who are affected by the task force. And they did work until half of the month, but did not receive a pay. I do understand their frustration. I am a healthcare worker before I am a leader. Number two, on their promotions. The first promotion we did was in 2018. Some of them have gone for the 8 years without being promoted. And we did have a negotiation with them, written agreement, to stagger the promotions based on the resources available, and they have been graceful enough.
Honorable Chairman, point of order.
Yes.
I think probably allowing the witness to pitch to us things that we don't understand. Maybe we can put to her some questions. I don't find the information she's giving useful. Okay, to me, she seems to be pitching. The question you asked was simple. Then all the hospitals are closed and people are suffering. And you are telling us here things are okay. Are you responsible?
To the honorable member of the House, I think it is fair and only fair for our citizens to understand the circumstances that have led our health workforce to go on the strike. And of course, being a health professional with a Hippocratic law, you're not supposed to leave the workstation without anyone to attend. But it is also fair for everyone to appreciate the work that these staff do. And it is also fair.
Honorable Chair, maybe she can start by telling us how many
Honorable
people are
member,
sacked.
please allow Waziri to finish.
You know, she's talking about fairness and what have you. Can she tell us how many people are sacked?
Or the people that were affected, that were affected with the Public Service Commission was 662.
And how many ghost workers are you employed? This issue of coming here.
Honorable member, honorable order, please. I think that issue will be
to the honorable member of the House. I think
Waziri,
it is not fair to
Waziri. This is our house of procedure.
Yes.
And I will not entertain direct altercations with members. You have to go through the chair, and the members also will come through the chair.
Sorry about that.
So,
and Chair, as she responds, Chair.
Wait first, Honorable Member. I think, Waziri, the issue of personal emoluments is an item in our interrogation. So I will request Honorable Members, please, let us reserve some questions to when the item comes.
Well guided, Chair.
Yes.
Chairman.
Related to
Chair.
what she's answering, eh?
Darby, must be.
Chair, since we are reacting to the CEC's opening remarks, Chair, we are in this situation because of some action that precipitated the situation we are in. We all are in agreement that the situation we are in is not the best. Let me just ask Waziri through the chair, could we have avoided the situation we are seeing now? Waziri.
Thank you so much.
Chair, a related question, Chair, and then she can answer. I just want to ask Waziri and the CEO. You've indicated that you were given a notice, a strike notice of 7 days. Since the date you received that notice, what kind of engagement, if there were, that you try to reach out to the representative of health workers? Did you had any engagement with them to ensure that the situation is arrested before?
Through the chair, I will say that, yes, we did receive the notice, and this could have been avoided and prevented. And there are things within our means and outside our means. We have engaged the leadership, and I want you to understand that the leadership represent their fellow colleagues. We have had talks with the leadership. We have been engaging them. We have had with Her Excellency, the Deputy Governor. We even called the entire team to speak with His Excellency. And at that point, they said, no, we want our demands met, which included the unpaid salaries, the promotions, the revocation of the letters, issues to do with the medical cover, and the reimbursement of their SACCO deductions. And half of them, we have started working with them. We have a written agreement. But because of the time that lapsed, like if you look at the unpaid salaries, even the honorable members of the House had not received their salaries. And many counties have not received their salaries. On promotions, we have a matrix that we were working on. And we all know the situation after the Public Service Commission report came. It affected our Public Service Board. And we have already pushed, and the enabling department, the Public Service Board, has already made the advertisements in phases, giving health and critical services first priority, because we knew that our health services will be affected. This could have been avoided if we had the resources and if we had honored the agreements that we had with the said workforce. That is a dedicated team that has worked tirelessly to get us where we are today.
Chair.
Yes, Honorable Mosby.
Just a follow-up. Had His Excellency not made the pronouncement that he did, would we be here?
Thank you so much. I think there has been a misinterpretation, and I have talked with my workforce. During the audit, if you look at the report, there was the essence of the ghost workers, there was
Chair,
the essence
I seek so that we save on time.
There was the essence of the irregularity where we were
let
missing.
Waziri just be on point. It's almost yes or no without explanation.
Where there were, okay.
Waziri, you've been asked that question.
If the health workers had not been called ghost workers, because they picked that from the media.
Honorable
Waziri,
maybe for clarity,
yes,
I will request the honorable member to come up again.
I think she has said that it is the action of His Excellency that we are here.
Thank you.
Through the chair, allow me to say that was misinterpreted, that I said through the actions of His Excellency. I would want to call your attention to the entire House to look at the budget 2022, 23, 23, 24,
Honorable Chair,
24, 25.
the witness is guiding.
And the budget allocation that I had.
Waziri, there is one thing that I'm realizing. Waziri, I want you to be patient. Don't be tense.
Chair.
Don't be tense.
Chair.
Be patient so that you can get these things right.
Chair. Hello.
Yes, Honorable Tarbi.
Is the Honorable CC in order to mislead the House and say that the medical workers are on strike simply because in the social media they have been referred to as ghost workers, when the same staff were here demonstrating and they presented a number of issues. One of the issues, Chair, some of them say that promotions, which the CC is saying, is being done in a biased way, that some are promoted and others are left behind. They demonstrated, I think they presented a number of issues, the reasons why they are demonstrating. And from those reasons, I know the issue of ghost workers affected all the departments. But in the health department, they cited a number of issues, including the remuneration, that the effects of the public service, the repercussion from the public service board, and the same CEC sits in cabinet with governor. When they implemented sucking out the medical practitioners chair, I think she's one of the advisors of His Excellency the Governor. So misleading the House that it's just from the results of that there is a name in social media that's called ghost workers. Because when we saw some of them, they are our doctors in our hospitals whom we have been seeing. I want to that the CC should withdraw that the main reason for their demonstration is just the term being referred to as ghost workers. That's not the baseline of all this.
Honorable Chair, I do not wish to interject very much, but maybe that's how she thinks.
And maybe, Chair.
So as a committee, we can just conclude, she's telling us here how she cares. But
Chair.
Maybe that's how she thinks.
Chair, maybe the Honorable Member interacted before I wind it up. I know our CEC is a travel person. In great democracies, like where she has been traveling to, she has studied abroad. And we saw, Chair, the dissatisfaction from the workers. The two officers have confirmed that these are their lowest moments. And the CC has confirmed that she has served this county diligently for 7 years. And they are saying that this is at the low moment. And I want to concur with her, Chair, that indeed these are low moments in our county. But to my perception, Chair, if you are served diligently, and this is the low moment, we cannot wait for the patients to die in our hospitals. Doesn't the CC thing, maybe these are the high time, maybe she should hang her boots, because from the clear demonstration, Chair, all those staffs have no confidence in their leader, and the leader in the departments is the CC, and they demonstrated that clearly. Maybe it's a high time that the CC should consider maybe hanging her boots in quotes, Chair.
Chair, in conjunction with the Honorable Tarbe, I've heard Wasiri saying that they don't have resources to employ. And again, they are going ahead to advertise the jobs. While our children are crying outside, they are qualified. So I don't know why are they advertising the jobs at the same time they are the workers who are inside. It's not making sense.
Waziri?
Through the chair, thank you so much to the honorable members of the House. All your questions are valid, and I deserve to be asked those questions. Number one, I did mention the reason why they are on strike. I got the notice, and it is in regards to the unpaid salaries, the slowed promotions, the revocation of the letters, the medical cover, and the remittances. I have been speaking to my healthcare workforce, and I have gone to the field. And I do sit in the cabinet, and when I sat in that cabinet, I made it clear and mentioned it, that this is a critical service. I have sworn with the hypocritical law myself as a healthcare worker. You're not supposed to abandon station until there's somebody to take over. I do understand the frustrations of the healthcare workforce, and I will say that at no point do I intend to abandon fighting for the rights of healthcare workers in Kenya. I do sit in the HRH committee, and there is a policy that is being reviewed for the country, because healthcare issues in the country needs to be sorted once and for all. To the honorable members of the House, when I said I would really like you to pay attention to the budget 2022-23 on the personal emoluments, a budget cut of 350 million in the health department does a lot of dent, and a lot of unintentional incidences will happen.
Honorable Chair.
The executive have been gracious enough to increase my budget through the chair. But if you pay attention to the
Honorable Chair.
monument.
What is it, honorable member? Please let Waziri wind up, and then you will come.
I take exception to this idea of, where we are told to pay attention. Honorable Chair, please. Does she believe we don't pay attention? Do you even believe we don't know the budgets? Actually, we want to ask you about how you have used the big budgets that have been given to you. Maybe you can start by telling us the allocation for the 2 years, both in terms of personnel and development, instead of trying to take us through some guilty trips.
Okay.
Through the chair.
Waziri, can you wind up your submission on the first item?
Through the chair, I will say to the entire honorable members of the House that health financing is not sufficient in the country. And if we are given enough resources, because I mentioned all the specialized services that we have gotten, it's more expensive. We have doubled our health workforce. Most of the budget has come to health. If you look at the PFM Act, the 75-30 on what needs to go to development versus HR, health is a different department. Since devolution, when health was made a devolved function, I do not think they transitioned well enough to realize that 80% globally goes to human resource for health and commodities.
Chair.
Policy needs to change to ensure that.
Chair, I know, I'm sorry I have injected, madam, but I wanted the Waziri to restrict to Nandi. Now he's talking of Kenya. It's only Nandi whereby all the facilities has been shut down. Please, Chair, let us...
And in the same version, Honorable Chair.
Order, Honorable Minor, please.
In the same version, please allow me.
No, Honorable Minor.
I seek indulgence, Honorable Chair. Could she tell us what is the percentage of the proportion that goes to health vis-a-vis our total budget? Can she tell us how much? What's the percentage?
Thank you so much to the honorable members of the House. Through the chair, I will say that I do sit as a vice chair for the CEC caucus.
What is the percentage?
All the CECs in charge of health have the same HRH issues.
Could the witness take the question?
Waziri, order, honorable members. Waziri, you are giving me a hard time to control the honorable members. if you can just stick to the questions. You've been asked about
the health,
the percentage.
The percentage for the budget that comes to health is 35%, and most of it goes to the personal emoluments.
Okay, thank you. Maybe honorable members.
Honorable Chair, maybe
yes,
I can add to what Wasiri has presented. Let us put this issue into perspective. The issues that the union have raised are, all of us we can appreciate. The issue of unpaid salaries, that was paid on Monday. The issue of medical cover, it is, the department does not provide medical cover. It is a function under domicile in administration and public service. The issue of promotion, our role as a department in dealing with promotion is that we do interns and share. We do interns and share with the
Honorable Chair, it's
promotion.
good for the witness to answer questions that we have asked them. Let them not come here and campaign.
Okay, honorable members, I think Waziri and the CEO were responding to the issue of the reasons of why the health workers are on strike. So maybe I will allow that when we shall come to the issue of personal emoluments, we shall also address the issue better. So maybe we shall,
May I ask a preliminary question, Honorable Chairman, to the Chief Officer, just for purposes of clarity. You once served as a sub-county administrator, or is it a director? Did you resign? Have you resigned, yes or no?
As a sub-county administrator, or
you were once in a PNP position.
Yes.
Did you resign? It's a simple answer.
I sought leave of absence.
You sought leave of absence to work in the same government? Oh, okay, maybe you can take us through that a little bit.
Yeah, I sought the leave of absence for the position in PNP so that I can serve in the contractual position of chief officer.
So you are substantively a director? Oh, okay, so what are you?
I'm the chief officer, even as per the payslip it shows a contract of three years.
And what are you? What else are you? What exactly are you? Because you sought leave of absence.
I'm the chief officer for 3 years. Once my term lapses for
Chair,
chief officer, I will
let him answer on that position that he is on leave.
Yes.
What is the position you are holding before you became the CEO? The permanent and pensionable
The
position.
permanent and pensionable position I was interviewed on was a sub-county administrator, and I got the appointment of the same. And then I was appointed acting director till the time I was appointed as the chief officer. So substantively, I am the sub-county administrator as per the appointment and as per the interviewed position.
Okay.
Position cannot be filled because you are away on leave.
And that one is a question of the board.
Would I be okay to conclude that you are being favored and that this is part of the nepotism and favoritism that is against the Article 232 of the Constitution, where everybody must be given a right, fair chance? You are holding two positions in this country, two senior positions. Is that fair according to you?
Through the chair, in matters law, there is nothing called fairness or unfairness. It is practicability of the law. If the law provides that you can take a leave of absence and there is provisions to that, and the board has granted you or you followed the due process, then it is not being unfair. Yes. The only thing I can say, Honorable Chair, is that
maybe Waziri,
yes.
Bwana CEO, for a better understanding of the members.
Yes.
Can you elaborate this term, leave of absence?
Yes, in public service, you are when you are serving a permanent position, permanent and conventional position, and you get a contractual position, you can take a leave of absence or leave of service so that you can serve in that contractual position and then revert back to your previous position. It's like even a transfer of service within a county or a secondment. You can be seconded to a county government, you serve, and then you can go to national government. So for my position, I took a leave of absence.
Honorable Chair. Honorable members.
Honorable Chair,
yes.
just a question to someone who is purported to be the chief officer. If today you are released or relieved your duties as chief officer, then you go back to the previous job.
Yes, unless I'm summarily dismissed from service through due to gross misconduct, that I will not hold public service, public office, I will not go back to that position. But this position I'm serving, and I would like to seek protection and withdrawal of statement. I do not purport, Honorable Chair, to be the chief officer. I'm the substantive chief officer. The member said I purport to be the chief officer.
But my question is,
yes,
can that position be filled
yes,
while you are on leave of absence?
The best person to answer is the public
Has it
service.
been filled to your knowledge?
To the best of my knowledge, someone is acting on that position. But then the best person to respond to that, who does recruitment?
Okay,
who does promotion?
Let me rule on that issue.
Yes.
The CEO and all the honorable members. I think the issue on absence, leave of absence, I think...
I want to respond on the leave of absence. The law allows that. Let us proceed. The law allows.
Okay, maybe also for better understanding, we shall subject the same issue to the board.
Much as the law allows, but now, you see, he took a leave of absence to come and work within the same, you see, for instance, let me give an example. For a teacher can do what we call transfer of service, can come to the county, then later on, at the end of the term, they can go back to the TSC. But here is a situation now, the same wing of government, Isn't there going to be, because you look at the conduct of the officer, that you can have that don't care attitude, knowing that in any case, I can go back to my job. I mean, and I don't want to delve into this so much, but I don't know the morality, the moral aspect to this. I mean, what does it, integrity, I think I should say so. What does it say to the integrity? Why couldn't you be brave enough and resign and then take this contract? But anyway, Chair, maybe this one will explain to us why we are in this situation that we are now. As we speak, you remember the grievances of the doctors that came here. Some of their complaints is that there are people who have been retained in there, while others have been summarily dismissed. So what was the parameters? Why now we've been told a couple of staff have been engaged, they have an arrangement. I don't know what this arrangement is in the introductory remarks.
Okay, honorable members.
Maybe, Chair, before you leave this
Honorable Minor, I will not allow you for now. Honorable members, I want to rule so that we proceed. We still have a lot of items ahead of us. So the issue of the CEO on being on contract and having taken a leave of service, I want to indulge that let us leave that matter to be explained better by the service board and the legal experts for a better understanding by the committee, please. So maybe I will go to the next item, and this question is to Waziri. To certify section 36(1)(a) of the County Government Act. Tell this committee how many dispensaries and maternities are currently undergoing renovations through constructions, and have you managed to visit for the last 6 months?
Thank you so much to the to the honorable members of the House, I will say that in the reports on the financial year 2022, 23, 23, 24, we have submitted all ongoing works, all that are in the budgets. And I will say that one of my mandates is to ensure that the department is run well and all functions, which includes the development and service delivery, continues. And I will say that in the last 7 years, I have been to more than 90% of my facilities and visited the sites where we even have facilities that have not been operationalized, and some that are already operationalized, and some that have been upgraded. And I have also been part of the support supervision team with my team. And as a county government, I will say that we do have 7 hospitals, 14 health centers, and 133 dispensaries. And we do have ongoing projects like Kapsengere that will be going from a dispensary in a container to a level 3B facility once it's completed. Thank you.
Waziri, have you been to Captain Dispensary?
To the honorable members of the House, I have been to Captain Dispensary. I've been there in 2018, and I have also been there recently when it came out in the report. And it's the one in the Tea Estate. And this is a project that in 2018, we did have a renovation project, and we also had a maternity to be built in the same location.
Honorable Chair.
Yes, Honorable Tolole.
It seemed very clearly that the Honorable CEC went round the health centers after the ADHOC committee went round.
To the honorable member of the House through the chair, I have been to Captain in 2018 when we started the project, and when we had the report from the ADHOC committee,
Chair.
I did also go.
Point of order,
the
Chair.
facilities.
Chair.
Yes, what is the point of order?
Witness is giving wrong information. We are reliably informed that where ADHOC committee had visited, she was doing a follow-up on all the issues we are doing. Can she confirm or deny? And we have the evidence to that effect.
Thank you.
Can you confirm or deny, Waziri?
Thank you so much. Through the chair, when I went around, I did not only visit the facility.
Let her affirm, is it yes or no? Not stories, Chair. Please, let us save time.
Thank you so much.
Honorable Waziri, for clarity, I've asked a question. Have you been to Captain Dispensary?
Yes, I have.
When?
I have been to Captain Dispensary in 2018 and also in 2020. And I also went when I received the report to be someone in the house. And I think it's the rightful thing to also do so that when you come here, you also have the right information.
Honorable Chair, Honorable Chair, point of order, Honorable Chair, Honorable Chair. Was it a must that you had to follow the ADHOC committee after being told that we were going round? Because I remember, and I followed your page, that you went to even Kabiemit where we were during the investigation. You went to all those, and we have the evidence. Kindly, why did you change your mind and go to those facilities, especially those that you had or known to you that we had gone round?
Chair, now that she has confirmed that she was doing a follow-up visit on the specified projects by this ADHOC committee, isn't that clear indication that she was not conversant with the projects within her docket? Chair.
Maybe, Waziri, maybe I will pose a question and then we close that chapter. If the ADHOC committee had not visited these facilities recently, were you in a position, was it in your program of works or your plan to visit the facilities? And going by the visitor's book, Waziri, I personally, I was in Captain Dispensary. And going by the visitor's book, unless you convince me that you went there and you didn't sign the visitor's book, I went through the visitor's book and it shows that both of you, the CEO and the CC, you've never been to that facility before.
Maybe a question, Chair.
Yeah, maybe we shall take
a top-up question. This committee, this ADHOC committee chair, when the CC came, he was administered an oath. This committee also took an oath of secrecy, and our work schedule is confined to the ADHOC committee. I don't know which schedule the CC used in following, maybe where the ADHOC committee has gone to. Maybe she can explain to us whether she has maybe a mole from this honorable house so that he gets a schedule. Because how comes, like you are saying here, a dispensary where the CC has never signed a book, she now visits after the ADHOC committee visits? Maybe she should shed some more light on the same chair so that we know whom we are dealing, because maybe even the questions we have prepared to ask her, she already has a copy. Because if she can get a schedule of the ADHOC committee, how are we sure that even the questionnaire we are dealing with, she is privy to?
Waziri?
Thank you to the honorable members of the House. if you follow my page, I have been visiting the facilities randomly. I remember being a new CEC, and the first place that I visited was Tinderet. And I have continuously gone randomly, and I will say that the honorable members of the House have been so gracious, because I visit health facilities even at night without announcing to anyone. And I know some of you may know after I have visited, and
Chair.
I think it's...
Chair, please.
Honorable members, please, let us allow her to...
She's deviating from the question, Chair. You know,
Waziri,
the question was her visit triggered by the visit by ADHOC committee? And was it a coincidence that the same facilities that ADHOC committee made a visit to, she also made a visit?
Thank you so much, through the chair. I will say that I have been to more than 90% of the facilities, and I also have a team, which is the support supervisory and the MOHs in the sub-counties, that if I'm not able to reach a facility, I will call them and I will ask them.
Honorable
There
Chair,
are some
Honorable
facilities
Chair.
Yes.
Honorable Chair.
that are in my report that I have not visited.
How many health facilities have you visited immediately after the ADHOC committee went round? So that we get to know, since you came into office, you visited how many facilities, health facilities? It is as if you visited more health facilities immediately after the ADHOC.
Thank you so much to the honorable members of the House. It is not just in the immediate past, like in the last week or so, but if you look in the past also, there are days I
Chair,
will
please, let the witness stick to the questions. She has been asking a very simple question. Can she tell us the number of dispensaries or hospitals she was able to visit after the ADHOC committee? Chair, could you indulge and guide the witness? Otherwise, we are not moving.
Waziri, please, Waziri.
Thank you.
We are running short of time.
Thank you so much.
And
the chair.
if we continue the way we are, we might not finish the issue at hand. So I would like just Waziri answer the question first. Then if you have to give explanation, let the explanation come later. But stick to the questions first.
Thank you so
How
much.
many facilities have you visited when you realized that the ADHOC committee was going around the dispensaries?
Thank you so much, through the House. I am not sure of the exact facilities, but I'll say approximately 7 or 9 facilities, and many of those facilities,
we just need the number. It is 9. The question has been answered.
Oh.
She has answered. Waziri, what is the status of Keteng dispensary?
Thank you so much, through the chair. Keteng dispensary, I've been there more than 4 or 5 times. And Keteng dispensary is a type B facility. It is a new building that sits on a cliff. And the contractor did the work. The fencing has not been done. We dug the toilet more than 3 times and they would hit a rock. The last time that I went there, I was in Kapsean and Keteng, after the honorable member of the House of Nandi Hills sent me there, and we actually went with him, and I had gone also by myself. And if you go inside, it has been vandalized, and any facility that has been closed and has not been used, just like other facilities across the county, you will find them where they start breaking down, where there'll be issues with the ceiling or on the wall. But yes, that facility, I've been there about 4 times.
The ICT team, can you project Keteng dispensary?
is it?
Is that the pit latrine you are talking about, Waziri?
Is it?
Can she confirm the chairman if
Yes.
that is Keteng dispensary first of all?
Yeah,
I
yeah.
can
Can
confidently
you replay the building?
I saw it. I saw it. Through the chair, I do confirm that is Keteng.
Chair, let the witness hold on as we project.
Yes, that is Keteng.
Can you say about that that building? And before even I allow you to respond, can the CEO confirm the status of payment of the same project?
Thank you, Honorable Chair. The said project has not been paid. The contractor was seeking for partial payment for the works done, and as it is right now, to operationalize, this facility, Honorable Chair, we will look at the certificates that were raised by the contractor. This project is classified as a stalled project because the contractor did the works, some elements, bad elements in the community vandalized, and so the contractor wants to be paid for the works done.
When were they tendered?
I believe 2018 or 2019.
Chair, and what was the contract sum, Madam Chief?
Contract sum 3.5. Yes, I believe 3.5 there.
So, you as the accounting officer of the department?
Yes.
Do you adhere to the Procurement Act?
Yes, we adhere.
Do you fully adhere
yes,
to the Procurement Act?
Yes.
Can you convince this committee?
And Chair, as you respond on that, can you say there is value for money in that facility? Is there any value for money?
Yes, for the works done, I can say certificate reflects value for money. When a certificate is raised, it reflects the works done, and the works done reflects value for money. What I can only confirm is that as of now, because of this stalemate, that the project is not complete, it's not operational, that value of money is lost because the residents need to utilize this facility.
So you confirm that there is no value for money?
For the works, there is value for money. But utility of the facility?
Where do we see value for money for the works? And for honorable members, for your consumption, the tender was 3,679,080.
Yes.
Now, Waziri, I'm taking you back to the Procurement Act. The Procurement Act clearly stipulates on how these works should be managed. Are you conversant with the Procurement Act?
Yes, I am conversant.
What does it say about when a public entity procures for works?
One, when a public entity procures for works, we should get value for money in terms of the works paid should be commensurate with the works done. 2, utility of this facility, we should get value for money for the utility of this facility. And to get the utility of this facility is to operationalize it. To operationalize it, we need to pay the contractor the works done, if works done, and then we can retender for the balance of works not done. What we need to get a clear, Honorable Chair, is
Banasio, for such a project,
yes,
to have taken that long,
yes,
is it conforming with the Procurement Act? Is it yes or no?
No.
It is not conforming.
Yes.
Thank you.
Yeah. Let me ask him, the CEO, whether he's conversant with the functions of County Executive Committee entirely, as indicated in Article 183 of our Constitution. Are you aware of your responsibilities?
Yes,
together with the CEC? You
yes,
are?
I'm aware.
What is it about?
My responsibilities?
Yes.
As a chief officer is to account for the resources bestowed on me. 2, to procure works as per the laid procedures or guidance of the law of PFM Act. And to make sure all the resources under my custody are safe. Yes.
I want to remind you something, Banasio.
Yes.
On that functions, you are one of your functions together with your CC. That one of the functions in 183C is to manage and coordinate the functions of the county administration and its department. And 2 and 3, the County Executive Committee, that is the CEC, shall provide County Assembly with full and regular reports on matters related to the county. If you look at the sorry state of that facility, where government resources has been invested, and wananchi are not getting services, which is guaranteed in the Constitution, Article 43B, where you sit, the CEC and CEO, can you comfortably say you are discharging your mandate as per the Constitution? Do you think you fulfill the desires of this Constitution in discharge of your mandate?
I can affirm that I'm fully discharging the roles or the mandate as a CEO, and for this, Honorable Chair, when vandalism happens, it is not within my powers. Even if we operational facility today and tomorrow.
Chair, point of.
Yes, Honorable Mosby.
What do we mean by custody? Because this is the property of Nandi government. Sincerely, you've seen that this contractor did a very, very nice job. Honorable members and the CEO, a good job was done there. But now, is it the responsibility of a contractor to protect that property so that it is not vandalized? And you are saying that you are playing your role well. As a matter of fact, I'm looking at pending bills of similar nature, 28 of them related to construction and supplies, various supplies of commodities. Are you being fair to the people of Nandi and to the contractors, investors, people who have gone to banks to take loans? Then now, you are not paying him, and the residents of Nandi are not using it. Aren't you failing in your constitutional mandate, Bwana Chief.
Honorable Chair, this is a criminal activity that has been done to that facility. I would not say I will take responsibility because that is a criminal activity or a criminal offense, and it is collective responsibility of the government and the community.
Chair.
We've been...
Chair, please, something very important. I want to ask the chief officer, yes. When was that structure completed? Just give me. When was it completed?
I believe 2020.
How many years down the line? Nearly 4 years.
Yes.
Today you are realizing that it has been vandalized, right?
Yes.
You are realizing after projection, right? You had no idea. You had no idea on what has happened?
We had an idea.
So you had idea. What action did you take?
Okay. One, by then I was the subcounty administrator. We engaged the community and tried to...
Chair, I'm asking, since you took over office, it is 4 years down the line since the structure was completed.
Then, Chair...
2 years old in the office as a CEO. What action have you taken to ensure those culprits that have caused damage to government projects have been arrested? What action? And if there is any action, either in written form or what, could you provide evidence to this House?
Honorable Chair, there is another project so that we don't go back there. If it can be projected, I'm not sure whether pictures were taken. The Enego dispensary, but at least the residents there are gracious enough. We are not seeing vandalism. If it can be projected.
Is it the one?
Yes, that one.
Okay.
ICT,
the ICT team, please, can you zoom that structure?
And Chair, Chair,
proceed.
The money used to build this structure is the money belonging to the county government of Nandi. And we have the custodians here.
Honorable Chair, a question just attached to what Honorable Mosby is asking. I would like to get to know from the CC or the Chief Officer who constructed this structure.
Thank you so much to the honorable members of the House. I will say that when you projected Keteng and you have projected Enego, I will say that there are so many other buildings that had been built ranging from 28 years ago.
Chair, she should stick to the question. She has been asked who built the, what is it, Enego? Oh. Why do you have to give us stories, Madam CEC? Why do we don't need stories in this House? We are specific to the questions and answers.
Okay, thank you so much. The Enego is a facility that has been built through CDF when Honorable Sally Koske was there. And there are many facilities like that that she built that we came and completed and operationalized. And I will say that the matter is in court, and I don't know if it's appropriate for us to discuss Enego here.
Have you ever allocated any money through the chair to that dispensary that you are purporting to have been built by Sally Koske? Have you ever at any point in the last financial years allocated any money?
Thank you so much. Through the chair, allow me to say that during COVID, we did allocate some money to Enego, and we were actually about to open it, and we had the land issue. And we recently also allocated some money, and if you look at it, it's overgrown because there is an ongoing court issue.
How much How much, Waziri, how much money did you allocate during COVID and recently?
Recently, I think it's between 800 and 900,000. I'm not very sure, but it's in the report.
During
Not
COVID,
at the
through
top
the
of my
chair,
head.
during COVID, how much did you allocate?
I can avail that if my chief officer has it, but I don't remember the exact value because it's been a few years down the line, and the initial works was to paint, to harness the water, to do the water tank. And when we were getting ready to open the facility, we even had the medications that had been taken there. Then there was a dispute, and it is currently in the court, and the case is almost being concluded.
Chair, and was the two allocation
Okay.
utilized within the facility?
Waziri, I have now been given the records. The county approved second supplementary budget for the financial year 22-23 for the said project, which is Enego, a total sum of shillings 883,300.
Chair.
Yes.
Chair. That project in Enego, I know it very well. When it was constructed, I was a member in CDF, and I was the treasurer. I signed the check for that building. It was built 2008, 2009. So my question is, why did you allocate funds to that project and yet we had a case for the land? The land is, the case is in court because of the land. What measures have you taken since you took the office about that project for not allocating the funds when the case in the court?
Okay, Waziri, maybe...
And Chair, she has not
honorable
answered me.
members.
She has not answered me. The two allocation, was it utilized? And I see, Chair, let them project. I see some round balls. What was it meant for? Just see near the entrance, the main entrance. I see some round balls lying, covered by shrubs.
And Waziri, so that you will both answer the question, when did it came in to your attention that Enego had a land dispute case? When did it came into your attention?
Thank you so much, the honorable members of the House. We actually have pictures of Enego after the first renovation when we were ready to open it and drugs had been dropped to the facility. Are we allowed to discuss what is in...
So I don't want us to discuss that.
Yes.
I'm just asking Waziri,
yes,
when did it came into your attention that there was an
Chair,
issue?
for your indulgence, have you looked at the round poles?
Yeah. Waziri, when did it came into your attention?
Thank you so much. The committee there brought the attention to us in 2018, and we have been working with the legal department.
Now, thank you, Waziri. That was in 2018. And why did you went ahead to allocate 883,300 in the financial year 2022-2023?
Thank you so much. At that point with the legal department, the owner of the land had agreed to make the transfer of the land, and we had been in communication with the community, the owner of the land, and the legal department. And that was not honored after we had made the allocation, because the community has been looking forward to receive services from that facility that has spanned over 20 years, and many payments have been made for the same land. The land was transferred to the wrong person after the owner of the land had agreed to transfer the land through the legal department, and the legal department was handling that.
Okay,
which
thank you.
Further complicated the case, and that is why we are in court and it's almost being...
Thank you, Waziri. I will also request the team to project
Maybe
Captain,
Chair,
is it
before-
Captain?
Captain is pending,
Chair.
Chair,
Yes.
you are right.
Chair, before you
Honorable
proceed.
Chair.
Yes.
Chair, before you proceed, I hope I heard Wasiri clearly saying that they were ready to operationalize the facility had it not been the court case. Is that the true position?
Okay, Honorable Chair, let me say this.
It is Wasiri, Chair. I am asking the question to Wasiri. From our sentiments, it seems all systems were ready. It was all systems go if had it not been the court case. Is that the true position?
Thank you so much. Allow me to say that we come from a community where when land has been given for a good proceed, such as a church or a facility, we rarely run into situations like this. And we had a committee.
Waziri,
It's just a
Waziri,
question.
please, Waziri, I have requested.
I'm just-
Honorable member, please order. Waziri, I have requested you severally to stick to the question. You've been asked by the honorable member that had it not been for the court case, it was all systems go to operationalize that project. Is that the true position?
Yes, we were to operationalize the facility.
Let us now project the
Maybe
captain.
Chair, maybe
Captain, is it captain? Yes, dispensary. Waziri, from the records that the department submitted to this house, it is indicated that we have a maternity wing that is complete and operational in that facility. In the records that you submitted to this house, the reports, and I can request the secretariat to show us the reports that you submitted to this house showed that we have a maternity in that facility that is complete and operational.
Chair, with an allocation.
Yes.
To the honorable members of the House, there is no maternity, and I think that was captured in the M&E report erroneously.
Now, Waziri, whether it was an M&E report, the information it came from the department. And it shows that a new facility at Captain in Nandils sub-county, construction works, 1,640,553. The status 100%, complete and operational. So before we proceed, Waziri, and it is also reflecting in the budget. So before we proceed, Waziri, so that we don't take much time on the same, are you owning this report that came into this house, or you are disowning?
Thank you so much to the honorable members of the House. I did mention that I'm aware of Captain. It was 2018-19. We had 2 projects there. The renovations and the maternity. And if you go there, the stuff for building the maternity by the contractor is still there but never took off. And when we reviewed the report, the report with M&E, I think it's during the consolidation of all the projects that it was misreported. So I do stand by it was misreported. Thank you.
Chair, is she confirming that he supplied wrong information to this assembly, which is against the law? Chair, can the CEC and CEO confirm for participating in supplying wrong information to this assembly for consumption?
Now, Waziri, you know we must be honest with ourselves. And in the budget, it was properly captured that it was a new facility in the budget. So before even we go into the budget, Waziri, I've asked you a question. That the report that came into this house for consumption by the house, are you disowning it or it originated from the department?
Chair, let me remind the team that is PFM Act, Section 153(1). And as Chief Officer, I would wish you listen to this. It's a very serious issue that you have committed. Breach of the law. Section 153 of our PFM Act. The accounting officer for a county government entity, 1, is responsible for the management of entities' assets and liabilities, and P, shall manage those assets in such a way as to ensure that the county government entity achieves value for money in acquiring or using the assets. Are you conversant with this PFM Act? Do you feel where you sit that you've complied or there is a breach of the law? You've complied?
Yes.
Chair. As far as Captain maternity is concerned, don't you feel there is a breach of the law?
Okay, Honorable Chair, for Captain maternity, breach of the law is when we lose money or is when we don't get value for money. The question at hand is this: was there loss of money in whatever was done in Captain? We accept that, Honorable Chair, we did the reports and submitted for consolidation and onward forwarding to this Honorable House. When it was forwarded, in the process of forwarding, it was captured wrongly. But then...
Who captured wrongly, Wanasio? Who captured wrongly?
I'm saying
you said it was captured wrongly. By who?
Okay, let me ask. I'll answer that by asking you a question, Chair.
No, you don't ask the chair a question.
Thank you. So I'm saying this. I'm sharing the process of how we shared the report. We developed the report from the department, M&D for the department, and then we shared with the Treasury for consolidation and onward forwarding to the County Assembly.
Now,
so
when you shared the report to the Treasury,
yes,
this is at the point whereby now these errors came in. Do you agree with me?
Okay. We have the copy of what we shared.
No. What you shared
yes.
is not an issue of discussion
yes.
currently.
Yes.
The issue of discussion is what was brought to this house. And it was tabled in this house.
Yes.
This is a house of rules and procedures.
True.
So, what we are discussing, Waziri, is a report that was transmitted to this house, and we believe it originated from your department.
Chair, let me remind him.
Honorable member, and I want now to ask the CEO. You transmitted the same report to the county treasury. Do you agree with me that at this point is where the errors came in?
Chair.
At this point, Honorable Chair, I cannot confirm or deny where
so
the error
you cannot
occurred.
confirm or deny. So in other words, do you own the errors? If you cannot confirm or deny, do you own the errors? Because the document that we are discussing is a document from the health department.
Chair.
Honorable Chair, did you sign the report?
We shared in soft copy.
Did you sign? Who signed the report?
We shared through a soft copy so that it can be combined.
Again, Chief and CEO, CC, through the chair. Do you have time sometimes to proofread your report?
We have time.
After M&E officers.
Through the chair, we take time to go through our reports and.
So meaning you have responsibility to own the errors?
Yes.
Okay.
Yes.
Thank you.
I think, honorable members, the CEO has answered. Yeah, so let us proceed.
But maybe, Chair, so that he does not really believe that it's not against the law to provide wrong information, I would want to refer him to the Constitution, and particularly so to, and as I do that, I would like to point out that part of the terms of reference for this committee is to establish whether there was breach of the law. So if you look at the values and principles of public service, you will find that there is E, accountability for administrative acts. These are principles. F, transparency and provision to the public of timely, accurate information. Remember, this house represents the people. So if you give us wrong information, witness, you are in breach of the Constitution. I just thought to tell you so that you don't say that it's just loss of money. Loss of money is one of the other breaches.
Thank you, honorable members. Maybe we shall proceed to the next.
Through the chair, the CEO have been talking of value of money, value of money. If a facility like that of Captain, okay, you may look at it, it is a good facility. But if it is not operational, I think it is when we say there is no value for money. So you cannot say there is value for money and yet it is not operational.
Agreed.
Unless you are looking at the cost, the
Honorable
money
Vice
that
Chair,
was allocated.
Honorable Vice Chair, the CEO has answered that he agrees. So let us proceed.
Okay.
Yes.
Vice Chair, yes, I agree with you. And I said one,
Chair,
we look
let
at
us
the value
progress,
for money
Chair.
for scope
Let
of
us
works
progress.
and value for money committed to
I
that
think,
project. Yes.
Honorable CEO, there was. Can you project? We have two other more projections, and then we shall move to the other items. Maybe as the ICT team prepare to project, I want to pose this question to the CEO. If I say that you are in total contravention of the Procurement Act, Will I be right?
Concerning which case, Honorable Chair?
Concerning the case in Captain Dispensary.
And I will say this. I have not contravened any procurement law.
Are you conversant with the Procurement Act when it comes to procurement?
Yes.
And all the stages that should be followed?
Yes.
And including termination of works that are not executed by the contractor?
Yes.
So for a project to take 5 years, 6 years now, is that not contravention of the Act?
It's not contravention as such, Honorable Chair, because one,
Chair, I will now ask you another question.
Yes.
Can you give me the timelines in which a contract should be executed under the Procurement Act?
Okay, as we award, we clearly spell the contract or the term of that project to be implemented.
Yeah,
So
it is not about what they are doing. It is what about the law says. You've asked them about procurement laws, and he's telling us we do. Let them tell us. Let him tell us. He has asked it to do with procurement rules.
Honorable Chair, I think the member for Kapchorwa, Honorable Bet, can share with me any law that says when you award a dispensary, you make sure it is implemented within 1 year.
Who has said that dispensary? Chair.
Yes. Honorable members. Okay.
This way.
Let me clarify that.
Chair, we are talking of procurement laws.
In procurement,
yes,
we have a project life cycle. Yes. Do you agree with me?
I agree with you.
For such small projects, what is the life cycle?
1 year.
For that one?
Yes.
Thank you.
Let's proceed, Chair.
Let us proceed, Chair.
Chair.
Let us proceed. Can the ICT team
which one to
project Kamombe dispensary,
which is in Dalat? And as the project Honorable Chair, can I ask the CC, what was the budget for the Kamombe dispensary? And what was the scope of works? Yes, CC, continue through the chair.
Thank you so much. To the honorable members of the House, I know Kamgombe has had 2 projects that was ongoing, because there is the extension, and then...
Have you been to that place, Honorable CC?
Honorable members, please, let us allow the CC to...
Yes, I'm looking for the values in my report.
Through the chair. Honorable Chair, may I ask the CC, do you know what is the project on that in that place?
Okay, thank you. Thank you so much. Through the chair. For Kamngombe, it was the maternity block that was incomplete, and we had a lot of issues with the contractor. And I think at that time, the contractor, not just in Kamngombe, but we ran into issues where they did not have the capability, and said he had exhausted the resources. And it's not just that one. We even have other facilities that we run into the same issues, and that was 2022-23. And during the budget years, when we are planning with public participation and also with the input from the honorable members of the House, we may put for a project a certain amount and it's not enough. So the following year, there was an allocation to complete it, because you have other things like a toilet or the fair or a fence or a burning chamber, whatever is needed in that facility. So that allocation was done, and I remember the same facility. So there was the aspect of the renovations and the completion of the maternity block and all the amenities to help it to be operational, like the sock pit or septic tank.
You have not answered my first question. How much was allocated?
Kamngombe was 3.4 million in 2022-23.
So was the amount for construction of a new maternity wing or inclusive of renovation of the other dispensary wing?
That was mainly the maternity block, because the maternity block, that amount would not be sufficient for all the other amenities.
Through the chair, she can also furnish us with the payment status for the financial year 22-23.
Thank you so much. I think my chief officer should have, is looking through.
And through the chair, is this
now
maternity complete?
Honorable Chair, for Kamngombe, as Wasiri has said, the scope of works as portrayed there, building of maternity and fencing, but then the detailed scope of works are contained in the BQ, of which we requested to supply. On status of payment, the contractor sought for partial payment for this project, and we got, I believe it, the project has been paid partially, around 900,000 for this project.
So when was the amount paid?
We've submitted. We are trying to find out in the list of.
Now on the same.
Yes.
Can the ICT department project for us Chemnyogoson dispensary?
Chair, as the display is being sought, this department is apparently is notorious of not paying. Whom do you pay, Bwana CEO? Whom do you pay? Because apparently everyone, and I'm sure everyone is not getting paid. Where does this junk of money go? And we have a budget. Are we giving works that were not budgeted? Are we giving works that, or rather, I mean, do we follow the budget? Is it the budget that we usually approve, or there is some other budget? Because it's hue and cry from the contractors, your suppliers, a small contractor like that, a small contract like that. Honestly, a contractor saying that he or she has run short of funds to complete a project, a small project like that. I think you should be able to tell us, where does your money go?
Okay, thank you, Honorable Chair.
Bwana CEO,
yes.
You answer the question by Honorable Mosby first.
Thank you. Honorable Chair, I can confirm that we do implement the budget as is. The budget the budget estimates and the works that this assembly approves through the process that we follow, we implement fully. The challenge we have, what Honorable Mospe is saying, is that people are crying. These are projects we gave out in 2018, 2019. They've been rolled over for over 5 years. And as a department, we process the payments, and it is being completed at the treasury level. In this payment, we've had, I can say from our submissions, we've been paying, or we've been processing payments, and we've submitted to you, Honorable Chair. You can have a look at the projects we've paid. I believe the challenge with 100% payment got to do with disbursement of resources. In the last 5 years, before 2022, there was a time we went for almost 4 months without disbursement from the National Treasury. We've seen improved disbursement from 2022 onwards, and the same has been reflected through the payments we've been processing. I can commit and say, Honorable Chair, that all the projects that have been completed, we process the payment, but then at the tail end, or at the terminal end of the process, it depends on the resources that have been availed through the National Treasury.
Now, Waziri, let me take you back to Kamngombe Dispensary. You said how much money have you paid? Partial payment to the contractor?
Around 900.
When was that payment done?
23, 24. Okay, I do not know the month, but I'm confident and I'm sure we've paid in 23, 24.
Maybe through the chair, who was this contractor? Do you know him or her?
No. I only know the contractor through interacting with the papers. But in person, no.
So
and I'm not saying there is a criminal to know the contractor. There is nothing criminal.
No, there is no criminality in knowing the contractor. What I'm saying, Waziri and the CEO,
yes,
if this project you've advanced some partial payment to the contractor.
Yes.
And yet it is at the state which it is. Can't you see the value of the 900,000 that you are advanced? Is there any value for 900,000? Let us talk of what you've paid with that state of that project.
Chair, yes, I can say that because a certificate was raised, and in the certificate, it detailed the scope of works. That building, we can even do as a layman, we are not engineers. We can do calculation for the bricks, we can do, for the blocks, we can do calculation for the cement.
Okay, have you made follow-ups?
Yes, I've been following up the contractor because the cry of the contractor was that kindly support me by doing this partial payment, which is supported by the works done, so that I can complete doing the works.
Honorable Chairman, could the chief officer confirm whether there was such a milestone? What were the milestones for this project?
The milestones are in the
Did it have any
Project-
milestones?
project-
Did it have any milestones?
Yes, it is in the project implementation and for
Did it have?
Yes.
What were they? I want you to be very succinct, just
Okay,
brief.
let me say this.
Don't say much. What were the milestones?
The milestones or the BQ explains
Milestones.
the milestones, in my understanding, is a schedule of works or implementation process.
I mean, by the time you are paying this person,
Yes.
what were them? When were you? How many times were you supposed to pay him? Was it in the contract?
What? Okay.
Was it in
for
the
such,
contract?
For such small projects, I can say it does have quite a number of milestones. It's
So
one of-
you know, and what
just
pricks
one milestone.
What pricks me, Honorable Chairman,
Yes.
is for this CEO to go and negotiate as if he's doing his own house, and I say that the contractor was crying. Why would a contractor come and cry to you?
Okay. The contractor was pleading. Maybe
Why would they plead to you?
Because
You are
once-
following a contract.
Okay.
What were the terms of the contract?
The terms of the contract is that you complete the works as per the BOQ or bill of quantities. But then this contractor did the works up to that level and requested for partial payment. To complete
Was
the-
there any such provision in the contract for partial payment?
There is, the certificate justifies partial payment.
I have asked a simple question, Honorable Chairman. Was there a provision for partial payment?
No.
Okay.
Honorable Chair, the CEO is now
the
CEO is now confirming that he knows the contractor.
Anakene, Honorable Chair, after partial payment,
Yes.
are we seeing is there any progress? So far so good. After partial payment, after contractor crying, is the work complete?
He has not
No,
resumed
no.
site. So, and the safest thing is this.
Okay,
Out of
honorable
325,
members,
we have
Bwana
two-
CEO, let me rule on this
over
issue.
2 million
Let me
to
rule.
complete the works.
Let me rule.
Yes.
On that issue of Kamngombe, let it rest that way. Let us proceed. I want us to go to the issue of Chemnyogoson. Tell us about Chemnyogoson.
Honorable Chair, for Chemnyokoson, those are part of the submissions. I requested that I bring the BQ, which details the scope of works.
Okay, Waziri, are you aware that this project was allocated money twice? And from the info, and from the, respond, Waziri.
Through the chair, for Chemnyogoson, yes, I'm aware. And I think it is in the report.
How much was allocated?
2.1 million and 1.1.
Now, Waziri, to be fair to the public, the information at hand is that that building was done by CDF money. Now, what is it costing? 2.1 and 1.1 is 3.3. 3.3 million. And the building was done by CDF. So where is the value for 3.3 in that building, Waziri?
Chair, as she answers that alongside you as chair, let them give us the costs for putting up a new dispensary of such a size. because they must be having an average figure for such small dispensaries. Of a new one, what is the cost?
Thank you so much. I know we have, if you look at the new buildings, we have like the type A and type B facilities. I think they were ranging from 2.9 to 3.5 based on the terrain, how far it is, accessibility. And that was like 2-3 years ago, but I know the prices have changed. Even if you look at some maternities that were built the same model, the prices have changed. And a lot of the CDF buildings, I will say, were well built, have a good structure, but sometimes also when you're doing repairs and you're repurposing for floor of works, it will cost you, sometimes you have to do partitioning.
Chair,
Honorable Chair.
Are leaking.
She's not sticking. Chair, she's not sticking to the question. There were two questions posed. One, you pose a question asking, is she aware of the two allocation? And I also ask a question, how much does it cost to do a new dispensary? And she has answered one, 2.9 million. Let her avoid a lot of stories, Chair.
I have it in the report here. Chemnyogo's son is 1.171680. And the other one?
Chair.
Honorable Chair, there is also a project similar one for Lelmokwa. Maybe it can also, as soon as you remove this one, you can put them together so that they can be compared.
Waziri, maybe to assist you, the first allocation was 2,150,630.
2 million?
150,630. The second allocation is 1,171,680. Now, Waziri, what was the reason for double allocation?
Okay. Thank you so much. When you look at the pictures that you have put up there, you see the new building which is branded our colors. And you look at also there is a toilet in a facility, and you look at, if I'm looking at that building, just like we had Kitaor, Kapkole, that almost look like that for CDF, usually when you go there, you may find a leaking roof. Sometimes you find an empty building, like a pharmacy will need like the shelving or the equipment or the furniture in there. It depends on the bill of quantities, and I think in one of the reports that the Honorable House requested, my chief officer submitted that, and that should be accounted for in every BQ.
Chair?
I think, Waziri,
yes,
it is on record that your chief officer has not submitted documents to that effect.
And Chair,
it is the one that he has requested to submit by Friday.
Yes.
And Chair, she has clearly indicated that the cost of doing such a facility is around 2.9 million. I was adding up the renovation, the 2.1 and 1.7. It comes to a figure of 3.8 million for renovation. The cost of renovation is much more expensive than putting up a new dispensary. It's a classic example that should be one of the
Honorable Chair,
yes.
Honorable Chair, let me say this.
Waziri, maybe before I allow the CEO, we all agree that the structure was put up with CDF money.
Yes.
We all agree that.
To the honorable members of the House, I did mention that it depends on also the terrain and how far it is.
But the terrain there is...
No. On how the of the different facilities where we've gone from 2.9...
Honorable Chair.
Because there is one in Tinderet
Honorable Chair.
3 point something, but if you look at where...
Honorable Chair.
Built, I think it's Kitoro.
Point of order. Point of order, Honorable Chairman.
The point of order.
I thought did you ask the witness about terrain or the entity that put it up?
Yeah, let me give you a classic example of Tindre. There's a dispensary called Lengon. CEO is very well conversant. Where means of transport is a lorry, after a lorry, a tractor, after a tractor is a donkey. It is of the same size. We did it at a cost of 3.8 million. One chief, am I saying a lie? Is it true? It was 3.8 Lengon dispensary.
Yes.
With such a rough terrain. And you are putting 3.8 million for renovation, and it's of the same standard?
Chair.
I think for correction, it is 3.3. Can you tabulate properly? It is 3.3.
Chair, I have a question.
Yeah.
Chair, allow me to ask a question.
Yes, Honorable Tarbe.
Since I was not part of the team that visited the dispensary, I want to know if the dispensary is operational.
Chair, can I?
I don't think it is operational. I think they just reason. We don't even have not put the MFL code. We have many facilities ready, but we don't have staff.
Chair, and then my other question.
But it is ready.
My other question, Chair.
Yes.
Does the dispensary have a court case?
A what?
A court case.
No.
Not that I'm aware about.
It doesn't have a court case.
Yeah, that's why I was wondering why is.
And allow me, through the chair, allow me to also say this on the comparisons between the 2.9 and 3.8. And you look at that, and from the pictures that you've seen.
Honorable Chair, sorry.
Sometimes in 1 year, through public participation and the honorable members of the House, what is allocated may not be sufficient to finish everything. That's why the two allocations. And when you look at a building like that you have seen others like that.
Honorable Chairman.
When you have to do the shelving in the pharmacies, the equipment, the assessment chairs, is all included to take it to completion, or even the security around the building, like fencing it, because it's an open field. Some of them you find people grazing cows, and you have to secure it. So like the gates, the fencing around it to secure it, the water tanks, the toilets, the septic tanks for certain buildings, the burning chambers. And we have had those allocations done in different years. Like the other day we had the Ward Development Fund. There are facilities that need a few items.
That explanation is enough.
Okay, thank you.
Maybe honorable members, I want to bring an end to the issue on projects.
There is a request for a video on the same dispensary.
Which one?
Yeah.
You want a video?
I also
maybe I will allow Honorable Bridget.
Yes. Thank you, Chair. Through Chair, I visited the place, and the people, the community, told us they have renovated twice, and there is nothing to show because the ceiling, it was raining. There is no shelves, and they have renovated twice. So I'm wondering, Wasiri, why should we renovate this building twice? Yet there is no equipment. It is not operational. That is my question.
Chair. Through Chair. I was also among the committee who went to the site, and we found that the resident was saying that the building was built on 2005, and up to date, nothing has been done. Up to date, it has been renovated twice, awaiting to be equipped, but every now and then there is pull and push from the department. So maybe the ICT department can play the audio so that that is a watertight evidence.
Do you have the audios?
Incinerator.
So since 2000, Kudom go operational this.
Toma, sir. Toma.
2000. Kita CDF.
CDF. Mana ada?
County mana mana? Tadi ni dah.
Tadi ni tu. Agrangi.
Anggo ada video.
Toma. Ini misal.
Ini gitu ya.
Ana kami sekolah kan.
So Atebi guni gini toilet ini.
Banyak sah.
Kau ni kau ni.
Bawa saja pun dah kau di marambil. Marambil.
Marambil. Guna pendek bil saya level 22.
Ni kau ni.
Nah, ini motor jawab. Dependent from what?
Kini ni kau mana?
County.
Kau di ni bersih lagi je. Awak dah urut je. Aku sal. Aku bakar.
The first one out.
The first one out. Aku ada gelas aja. As derube kuno go boy.
Aku the tiles.
No, the tiles.
Flow in it.
Iya, gitu nih. Aku toilet ni. Aku le ya sogan muiswanan.
Muiswanan no ko
batar.
Diskro ke.
There is a game step by step.
Record sih. Kira nak kita ni magile kasar marambil ni.
Dile kalamu. Ona nyumo. Dio. Kami gini.
Record sko baru le kita kisah le tumi.
Kami juga nak korok
Kita.
Ah, saya gili walu batin. Robo tu saja.
Robo so kisah pos walu batin.
Kio ini kau tu robo selalu na tahu. Lihat tahu ini gitu. Aktang gitu. Jauh gitu.
Million zagai pokalai. Une rabi ini kiki kami nyuko 3 million. Kiki kya located.
Orang kaya.
Buat tail se.
Tail.
Ngulang ko.
Giga apa gitu ni?
Banyak ya gitu. 2023.
Melanggo je.
Last year gitu mas.
Last year ini mana melanggo aku salah.
Amoi. Kabu ini.
Sali se tu korani.
Acak sali se gitu. Pakai lagi gitu.
Mas Devin ni. Walu bagi meji waluis. Kayam tu.
Through the chair, to the honorable members of the House, I am just like the citizens over there. I would be very disappointed too.
Honorable Chair,
And I
can we play Lil Mokwa?
allow me to finish.
I think the
through the chair.
sentiments.
First, Waziri to respond.
I agree with the residents, and I will say that this is my 7th year, and I will say there are many facilities that were like that. Some of them had become stores. I will give the example of Kapsaga, Kitaor, Kapkole, Serem. There were beautiful facilities sitting there by CDF, and some of them are anywhere from 25 years old to when the first governor started some of the buildings, and many of them we have been able to complete and operationalize. Okay. And for the honorable members of the House, many facilities are ready and are understaffed. We just need the human resource for health.
Thank you. Thank you, Waziri.
Yes.
Do we have the one for...
I would like Lil Mokwa because it looks very similar to what you've played, Honorable Chair.
Lil Mokwa?
Lil Mokwa maternity. Maybe could the maybe you can focus on that plate over there where it was supposedly opened. How much did this cost and what were the scopes of work?
Thank you so much. Through the chair, I'm very much aware of the maternity in Lelmokwa, and I have been there more than 3 or 5 times. The money that was spent there was 2.7 million. I'm not, we will confirm with the report that we gave. And if you look at that facility, it is one of those facilities that we had to go and repair, we had to equip, they had a leaking roof, we needed to...
How many iron sheets were changed?
How many what?
Iron sheets.
I would refer to the BQ.
I asked how many, because you have been there many times.
I'm not part of the team that does the inspections, but we can refer that to the completion certificate and the BQs, what should have been done.
Did it ever come to your attention that only 3 iron sheets were changed? And there's ICT. Can you focus on the inside so that we see what she's talking about? If we have pictures of the inside. So do you also agree that that was done by CDF? Or some other national government intervention?
Yes, absolutely, yes.
And you spend similar amounts to do, I mean, anybody who goes there would be very disappointed. It's only unfortunate we didn't take an audio. But the people there would have said the same thing.
Okay, thank you.
Chair.
Thank you. Maybe to wind up on projects, honorable members, because we still have other items to.
Yes, Chair. I think I'm now confused, Chair. I don't know about the department. I think even me in our Chemundu Kamngetunj, we do have almost a similar projects. One which is not even one, about two. We have Kapkejui. I think Waziri is very much conversant about Kapkejui. Kapkejui has been finished, even equipped with tables and some seats. But now they are wearing it out. No personnel has been posted there, and it has been there since I became a honorable member, since 2019. The building is ready. It is equipped with tables, chairs, no personnel. If you go to Kibirbe is not complete. But I think I share part of that Kibirbe, the challenges that we are going through. Because recently, the department make an effort of sending a contractor to that place, only to realize that most of the people surrounding there are saying the project is in the road reserved. And I have made an effort on department to come and refence so that the work can begin. Because I'm a worried man. People are saying the county government is injecting some cash.
You can have that one. You can have that one also. By the way, Honorable Sweep. Let it be beamed.
Kibirbe.
Oh, okay. Maybe we had given the ICT. Let them project the LOL Geringet, and as they do that, Waziri, I want to pose a question that was directed to me by the public. And they told me, Mheshimiwa, you punish us when we are alive, and you continue to punish us when we are dead. What is your take, Waziri?
To the honorable members of the House.
Speak to the mic, please.
To the honorable members of the House, as a medical professional, you're supposed to treat every human with dignity from birth to death. That's my take.
So now, Waziri, as we wait, maybe that statement that was posed to me by the members of the public came in because of the mock that is not there in Kapsabet.
Mm-hmm.
And going by the records of this house and through the budget, we allocated 15 million for the construction of the mock. And actually, that is Lol Geringet dispensary in Kabiet Ward.
Honorable Chair, if you can allow me. Oh, sorry.
Is it working?
If it's operational, Chair, why would the department renovate the facilities which are not being used and leave such a facility which is being used? What is the priority of this department?
Misplaced priorities.
Actually, Chair, I thought also to ask a question.
Order, honorable members, please.
May I ask a question,
Yes.
Honorable Chair,
Proceed.
to the CEC? It is alleged, and I would like to seek a clarification from you today. Do you own an hospital?
To the honorable members of the House, I am one of the directors. I'm not one of the directors, but my child is of Rafa
Do you
Hospital.
own an hospital?
And I think
Chair,
since I have been CEC,
Chair,
I
it is a
stepped
yes or
aside.
no. It is
Order,
a yes or
honorable
no.
members.
Chair.
Let us allow the CC to answer the question. Waziri, do you own an hospital?
To the honorable members of the House, Rafa Hospital was in existence before I was CEC in charge of health. And since I have been CEC in charge of the health, I have never even attended a
Answer
board
the
meeting.
question.
I have not been working in there, but the same people that that run it are nurses like myself, and we did it to provide best practices, good health care of what we know for Kenyans.
Okay.
Chair, I asked a question.
Maybe to revisit that issue, Waziri, and without malice. Can you compare the services offered in Rafa Hospital and the county referral hospital in Kapsabet?
To the honorable members of the House, I come from Nandi County, and I have sought services in some of your facilities in Nandi County. Kind of investment.
Chair, when will the witness stick to the question? She has been asking a very simple question. Can you compare the facilities in Nandi with Rafa in Eldoret? The answer is very
I don't think we are being fair.
Honorable members, please, let us allow Waziri to answer the questions.
But Honorable Chair, the CC is taking us in circles.
And maybe Waziri, please.
You are not
you
here to
know
waste
now
the time.
you are giving me an hard time as the chair, because now when you deviate from the question, that is what is bringing all these interjections.
Thank you so much. To the honorable members of the House, I respectfully will give you an answer to that. I will not plan for my people in Nandi County what I would not want them to have in the best of healthcare. But with the limited resources that are there are many facilities that will break down because a building is not used and there is not enough. Remember, when you do the budgeting, it comes from public participation.
Point of order.
What is the point of order, Honorable Bate?
Was it a description of our facilities? Was that the question we had asked? To give that a brief description of the state of our facilities.
Okay, Waziri, can you just make a comparison and you end the matter?
I will say that where we have come as Nandi County, the services that we have today, we did not have when I started the work. If we have better health financing in the country, we will have more money for renovations, more money for workforce, more money for equipment.
Okay.
and
Honorable
we should be
members.
we have a team that
Order, honorable members, please. Maybe
the chair is disobedient, chair. The witness is disobedient, chair. I want to say this.
Disobedient.
She is very disobedient.
No.
And not compliant to the directive of the chair. In regard to the questions raised.
Honorable Bitok, what is your
Chair,
issue?
I know the witness, she's also senior. And when you are senior, an African woman, they don't stay yes. But I agree that she has accepted she has, yeah, when she say,
no, point of order. That way, Honorable Altem, you can't take us that way.
she has accepted that she cannot do whatever part to the people of Nandi County, but in our hospital, the services are almost the same. So I think she has agreed. I think she has agreed. So that is why I was saying, senior women, especially at such a time, they don't say yes.
Chair,
okay,
Chair.
honorable members, please.
Chair, my question has not been answered.
Let us leave the issue of the
Chair,
comparison.
I asked a question.
Yes.
Concerning this facility.
Yeah,
Why would the department go and renovate a department twice, and a facility twice, which is not in use, and leave such a department, a facility which is in use, Chair?
Supplementary question. Wasiri and CEO, have you been to the...
To the honorable members of the House, I think we all know that when we are doing the budgeting process, we go for public participation, and the priorities and the allocations, there is collective responsibility from the citizens as well as to the honorable members of the House. As we sit
Point of order, Honorable Chairman.
No, I will not allow. Please proceed.
As we sit here today, when we were getting user fee for going
Will you allow
18 million,
pharmacies to go into record?
18 million, we could barely meet the needs to do service delivery.
Point of order, Honorable Chairman.
If we can get
Let the CC
all
just
our citizens
answer the question.
Honorable Chairman.
Chair, we cannot allow
She has
CC
been asked
live
that
to this House.
Order,
Actually,
honorable,
Honorable Chairman.
order,
We have just seen money being thrown away, and then this officer keeps on saying there is no money. We also know that they have been employing ghosts, and then she keeps on saying there is no money. How we agree, yes, how could there be money when you are misappropriating it? We cannot possibly have it.
Through Chair, Wasiri and Chief, when was the last time you were in that dispensary?
Honorable Chair, let me say this. The government operations, we operate on budgets. And the way the budgets are made, all of us are participants. I'm happy the Ward Development Fund is here with us.
Point of order, Honorable
Point of order, Chair.
So let me say this. Allow me to...
You are deviating from the question. And
okay.
Kindly let me direct my question to
Order, honorable
Wasiri.
Please, order, honorable members.
Allow me to complete my statement.
Maybe I will allow Honorable Sum.
Okay, thank you, Chair.
Deviating with the questions.
Thank you, Chair.
Order, Honorable Koko.
Thank you, Chair. The CEO is talking about budgets. But our concern is implementation of those budgets. How is the department implementing the budgets?
Okay.
It seems as if the main interest is the contracts, but not the functionality of the facilities, not the sustainability of the facilities.
Honorable Chair, let me say this. As earlier claimed, or as submitted, one,
maybe so
we are all...
Maybe so that to answer, I want to take you back to the question raised by Honorable Tarbe.
Yes.
That why should we put money in facilities that are not operational, and we are leaving out facilities like the one that is being projected there?
Yes, I'm answering this way, Honorable Chair.
On issues to do with the equitable share,
yes,
I think that one should not come as a matter of discussion.
Okay.
Because its implementation has not even started.
Thank you. So let me respond this way, Honorable Chair, that we are all leaders. One, we understand...
Honorable Chair.
Honorable Minor, please, let us allow the CEO to wind up.
But we cannot allow sweeping statements. We are all leaders. What does that mean?
Before even he responds, you are interjecting, please. Let us give him time. Proceed.
Honorable Chair, we understand the process of budget making. We go for public participation. The community identifies the projects to be completed, the projects to be initiated, and we consolidate all this in a budget. there is no other money in a department.
Chair, if I can listen, Chair, your indulgence, you've redirected many times, Chief Officer, to explain the reason as to why money is being allocated to a facility that is not operational, other than instead of putting those investment in a facility that is operating, and is giving us stories.
Even those which have got court cases. He puts money in a project that has got a court case, but proceeds to leave the people of Lol getting it like this. And then he comes here, Honorable Chairman, to talk about budgets. Isn't it the reason why we employ people and pay them well to be in the executive? So that they are experts.
Okay, honorable members, I want to rule that...
Before you rule, Chair, before you rule, we have an audio, a video. Kindly let the ICT officer to play for us. On the same dispensary. The same dispensary.
Lol keringet dispensary. En sipitali ninyonet ni ko kikelalamikan ngalek chechang, makitindoi beek, makitindoi kerichek, makitindoi chang kikome en sipitalit barak silimbot kikome silimbot ak kikimeche keyat matanet makinyoru beek, makitar en kotab matanet komie amakitomo keondonwe yoba ile isin uroni sipitalit komie makiondonwe ko kasome ane nekisomen nyo kechobwech beek kikebe in kiakesom dona kikesom dona nekikonyoindo ko kikesom kelechi toretech beek ko kikoyonwech tonai nitok beek ko kotko kikoib paipinik tona ko kito nemitei ko ngalekab chepkondok chekibetwech ketoune kasit sikobwa beek akoi yu. Mitei oinet nemitei in barak yun bwone beek bunu kapchuma yun.
Ko ne nekikotorto county nguno akoi nguno etab kiteche hospitalit nguno ko ne age?
County ko ngelen kemwochi koibu kerichek cheng'ering'en chemayome. Ko koib akot oin cheng'ering kabisa cheu chebo ukimwi kityo.
Daktariekab yu kou ne?
Daktariekab yu kowolchingei. Nyone age wikit age, konyo age wikit age. Kowolchingei asin ng'alekab daktariek eng yu.
Ko somutik ko ne?
Ko somutik chuk asome ane keyotwech matanet eng yu ak kekonech beek. Kimeche beek matanet koni.
Angele kikobutok olabo siling ko ne nisome?
Kikobutok siling kisome keyochi renovation koitok miosni. Age ng'onyoli ketem. Ko kakonech rabinik kidogo chuko mayome akot lakini kokilen kesirte kele katoyai renovation lakini makoi kiyai renovation amu ng'ering'en rabinik chotok. Rabinik chotok kobekyin in watchmen ak biikab wafanyikazi chebo eut.
Kongar ne ng'olyo nebo let?
Ng'olyot nyu nebo let ko kasom county kotoretech sipitalini sikoibwech ku kitandok ak koyotwech matanet. Ko notok ng'olyot nyu nebo let.
Before I allow you to respond on that, I was among the team that visited that dispensary and the one in Kamng'ombe. And our findings was really the nurses in charge there, both of them, had to leave the facility to take their children to Moi Teaching and Referral Hospital. And they are the nurses in charge for this one and Kamng'ombe. So in such like scenario, Waziri, what is your take? Whereby the nurse in charge has to leave the facility that he performs her responsibilities to take his or her child to another facility for treatment.
To the honorable members of the House, I will say that within the resources that we have the goodwill to improve healthcare in Nandi. Unlike what I just heard, if we did not have the goodwill, we would not be investing in our human resources, on the specialized services that we have today. This is a journey since independence, and I can confidently say that what has happened in Nandi in the last 5 years has not happened since independence. And given the resources in in health financing, if we can all be advocates to have everyone to register for social health insurance, we will get better financing. And I think I have presented this before. We have a population of 1 million with a budget of 2.9 billion, 2 point something going into human resource. When we are done with the brick and mortar and the building, there'll be more money available for human resources and commodities and equipment. We know what we want for our people of Nandi. The user fee for GONE was only 18 million. If we can have everyone register, we'll be getting an additional $500 million. Assuming that only 3% to 7% seek services, we will have more human risk, we will have more health financing.
A follow-up question, Chair.
Chair,
Honorable Chair, allow
me. Let me add to what Waziri has said. On
Chair, allow me.
Maybe before I allow you, Bwana CEO, let us have the concern of the honorable member, so that you will respond to all the issues raised.
Thank you, Chair. Chair, my question to CEC. I know we are shifted to social from NHIF. How will you convince that old man to register for the social health insurance fund when the facility that he's supposed to visit with that card is that facility, Chair? Will that person be convinced? Maybe the Wazir can tell us.
Maybe in conjunction with that, Chair, if you allow, that we are only confusing two things. Because if the CEC here is talking of not enough sufficient funds in facilities, while we are talking of the little that you have received, have you used it in prudently? That is where we have a question. That's where we have the difference. If you cannot spend, if you cannot use 1,000 shillings, how do you expect to use 10,000 shillings? Even if you will be given. Actually, what we wanted is you to demonstrate the little that you have. Have you used it prudently? So that we add you more.
Okay.
Thank you, Honorable Chair. I can confirm to this Honorable House that one, all the activities, all the projects that we implement are itemized and are budgeted. For Lol Keringet, we don't have any other money as a department. We are operating on limited resources. It is this house that approves itemized budget for each project, and these are government. So the discussion or the way members are debating or putting us on defense is as if we have some money, we have unlimited resources only to utilize. All the projects that are implemented are in budget, and it is passed by this house. Secondly, on the issue that you raised about that child, I can respond this way on top of what the Waziri has said. That nurse, as you've clearly put, she went to MTRH. It depends on the condition of the child. If that nurse, based on her training, wanted to see a pediatrician is a medical officer who are specialized in seeing children. So it depends on the condition. We cannot limit our nurses or even or the public in seeking a specialized service. So it depends on the condition, Honorable Chair.
Chair, I have a follow-up question, Chair.
Chair,
allow me.
Yes.
Does the department have a structured maternity of how maternity should look like? In terms of structure?
Yes, we have the workflow on how maternity should have and the amenities in it.
Thank you. Yes. Now I have a question, Chair, concerning Sojoi Dispensary. There is a maternity. The chairman for committee, they are saying the maternity was constructed by the county. But I understand the structure in which the maternity was designed. We were told that the public health officers have condemned the same facility, which was constructed by the county, and it is supposed to be a maternity, but the structure itself was not designed to be a maternity. Maybe what does the CC have to say about the same?
So, Joy, that is not a maternity, that is the OPD, the old OPD. The new maternity wing is up there. It's a new building, and we budgeted 1 million for completion works. So, it has not been condemned, it's a new building. Honorable Minor can confirm that the building is structurally sound. It's only that we need to provide amenities such as septic tank, and yes, that one.
Through the chair?
Yes.
I also visited the facility.
Yes.
But the question there is that the way the building or the rooms are designed is not, does not fit to be a maternity.
Yes. For it to fit to be a maternity, the rooms can be changed, demolitions can be done within the rooms, or the way.
What was the initial plan when you were constructing this facility?
I think to operationalize that maternity.
Chair, let me ask, have you ever been to that facility?
Yes, I have been to there severally. What is lacking there is septic tank, so that we can operationalize.
I mean, the design.
Honorable members, yes. Let us have order, please. Maybe if I can interject and ask both of you, the CC and the CEO. The CEO is proposing some demolitions on the same structure. No, it is on record. It is not my words. Is proposing some demolitions on the same structure so that it can fit to be a maternity wing. Now, what was the initial design?
Initial design is a maternity wing, and maybe the point that the person is saying, we have a problem, we need to get to know so that we can amend appropriately. Otherwise, demolition I meant, Honorable Chair. Let me use the correct term.
CEO,
yes.
You say you are admitting that already there is a problem there.
The problem that is there, Honorable Chair, is the ceiling. The septic tank that is not there in place, the amenities that I'm saying, wiring, and...
what about the proportion to demolish some partitions there?
Okay, I said we can do amendments.
Waziri, please, can you allow the CEO? You are confusing him even further.
Or she can take up the...
Or you take up the issue, Waziri.
To the honorable members of the House, I know that facility, and I know the old building that is dilapidated. And when we took over in 2017, there was a slab that was condemned because it had overstayed, and I don't think it was safe to build on it. It is a facility that I think was almost like a quarry, or looked like things had been dug in, like it needs a lot of work to be done around it. But that maternity
Honorable
has
Chair.
been inside.
Honorable Chair, now that the witness, Honorable Chair, now that the witness has mentioned a structure in which the county government lost money, because it is just there, and knowing that governments exist in perpetuity, what did you do to recover the money lost? What have you done on that slab you have just described?
Record chair, there are 2 slabs. It's not one. There are 2 slabs before this that structure. So the count is like this. I don't know which this animal which digs holes and as he leaves and move. So they have constructed the first slab, leave that one, construct the other one, and then now the facility.
The facility is the 3rd one. We have 2 other slabs.
Yes.
Can we? Is it the ICT team? Did you? Yeah, that one. That one is the first one. What about the second one?
The one now the CC is saying.
No, it is as you walk into the facility is right there.
Yeah.
That's okay. What have you done?
Honorable members, let me allow Waziri. There was a question about the morgue in Kapsabet.
Yeah, even I'm worried.
But before you leave,
I'm worried, Chairman, today. I'm worried because we have asked questions that are not to my satisfaction. They have never mentioned anything to do with Kibirbe. They have not mentioned anything to do with Kapkeju. And those are the buildings that they are ready for operational.
Okay.
Chair, why are we taking
Let me allow
Let us be
the CEO
straight to
and
the point.
CC, Can you respond to the issues of Kibirbe
and those slabs,
and Kapkechui?
And those slabs, Honorable
Thank
Chair.
you so much to the honorable members of the House. Kapkechui is ready, and I think I have mentioned this. Before the Public Service Commission verdict came, we had made a request for 114 nurses through the Office of the County Secretary. And that disruption, and that is mainly to operationalize facilities. We have our nurses overworked, overstretched, and the healthcare team, and then this happened. So that disrupted, but we need staff. We need more staff. Because if you look at our staff establishment, we did our HRH strategic plan. We have nurses, about 140. Some have left, some have died, some have retired. And yet we have hired and we have opened more facilities and we have added more specialized nurse services or upgraded health centers that needs more workforce. The Honorable Member Keter, I will assure you as soon as we get the workforce, we will open Kapkechui. In Kibirbe, that is the one, if you get there, I remember the first time we went, the dispensary was at Lintel, and it was almost like in a corner, and what was needed was the contractor to continue with the works, of which just like any other facility, Kikibirbe is in Chemundu. And the roofing has been done, and there is funding that has been put in that. I know there is a burning chamber. It is in a very small piece of land.
Maybe,
It's
Chair,
a very small piece of land.
maybe we should ask for those people to project.
Yes.
The issue with the Kibirbe Wasiri, it is that it is in road reserved. And that is what has really made that thing to be stuck. So it should be fenced, because we cannot continue pumping money on something that it can be demolished at any other time. That is the allocation which is there. And I think I have shared with the CEO, and he promised me that we were to go with the surveyor, with the document, and even with the title, if you indeed that land, it is there, it was bought by the department.
Okay.
Chair, before it is displayed, maybe you will see for yourself, Chair, how, I mean, you wonder, the dispensary is right on the road. Some corner of the dispensary can be easily hit because it is like it is blocking the main road. And then the toilet is on one side of the road, and the incinerator is right just on the road. It's very interesting how public money.
Can we have the same being projected, please?
Yes. And given chair that patients will be attended there. You wonder how patients will be attended. At the same time, across the, or rather in the middle of the entire facility, you have vehicles, lorries, and it is a very, very busy road. Maybe it can be displayed. Then we see what we can say about the leadership and the management and the custody of value for money and all that sort of thing.
Okay, thank you, Honorable Chair. As Honorable Minor said, that there is perpetuity in government. That facility was established way back in 2015, 2016, and the only way to operationalize is one, we hire staff, of which we are assuring this House that with the ongoing regularization of staff, we will we'll get staff to post there. Two, on the road, we will just have to fence, because the other option that we have, or you could be proposing, is that we leave the entire building and then build it on another land, no, which is not. That is not the spirit. We agreed.
Chair,
with
Chair, is it in order for CEO to say that we leave the building which has been injected 2.5 already?
That is why I said, in the spirit of perpetuity of government, we have completed that project and we will operationalize.
Can we have
they will.
Hold on, Banasio. Can we have the facility projected?
Well, through the honorable member of the House, while they are projecting, I know Kibir Bay very well. It was a project begun in 2015-16, and we found it at Lintel, and for that definitely went through public participation, and we put resources to continue. The roofing was done, and the honorable member of the House and the citizens living there also put in to ensure that they get the services that they need. I think it is only fair that the facility is completed. And I will also mention this, the MCH, one of our facilities at Kapsabet Referral Hospital here has a beacon in the middle of the building. And those are buildings that was done way before then, before they were doing proper follow-up on surveying. But through Public Works, we have made a request to Kenya in regards to what happens to the building and also branching into the new hospital facility from the main road.
That is, which facility is that one? Kibir Bay?
Let me go my glasses. Yes, that is Kibir Bay.
You know, Honorable Chair, the thing that worries me is to hear officers on whom we have placed so much trust. We expect them to have some expertise. You know, when they come here and begin looking like they are really clueless on what should happen, it's really perturbing, to say the least. And blame game.
You can see that the corner has already been hit by maybe a lorry. And the toilet is on the other side. That's why I once said, so long as it is a contract, Chair.
That issue of Kibir Bay is a safety issue that needs to be addressed.
Yes.
So maybe...
And Chair, so the point that I was putting across, I have requested department almost more than thrice that we should visit a place with a surveyor and furnish maybe this house with the same document, because I understand the land was bought even before. So up to now, even the last contractor you sent to the site, they have put material down there. I hope you saw some sand, there is cement, but now the question some elders raise a concern that, are you sure this building it is sitting on this land or at the road?
Okay. Honorable members, I want to direct that we move to the next item.
Just one final question.
And maybe before I allow your question, I want Waziri to answer the questions on the morgue.
To the honorable members of the House, I did mention that we should treat a human body with dignity from birth to death. And we did put 14 million in the Kapsabet funeral home. And if you look at the location of the new MCH building, we had the morgue behind it that we had to take down. And the location of the new funeral home is a little bit down from the facility. And we do have a dump site that is there, and since 2017-18, we did give a notice for administration to move the dump site, and there have been a couple times where they have had land issues, and finally they have found land next to the forest where they will be relocating the dump site. And so just for...
Which forest?
Iruru. Towards where, I think that's where the sewage goes. Because I think they were procuring land at one point, and the community...
Are you sure of what you are talking, Waziri? I'm there, MCA.
Maybe even as she says that, Honorable Chair, is she also aware that the Sustainable Waste Management Act outlaws the establishment of dump sites? Are you aware?
I know there are many options that have been sought. One from having the recycling place in Kaimosi. There was public participation on that. There was land that they were looking for. And the last one they were pursuing was the erosion.
Okay, Waziri, let us not go to the issues of the dump site, eh?
Yes.
Can you restrict yourself to the issue of the morgue?
The morgue.
Yes.
As at now, we will be capturing that in the supplementary based on what other cuts we have, because I mentioned earlier that my budget last year was 3.28, my budget now is 2.97. While we are making the budget, I'm always way above ceiling, and this was one of the imminent ones that we were not ready to implement.
Now,
right
Waziri,
away.
Waziri,
But
I want to pose a question to you.
Yes.
What was the reasons of demolishing the existing morgue when a new one is not yet complete? And now that the issue of the question that was posed to me by the public, that you punish us when we are alive and you punish us when we are dead. And are you aware of a body that was eaten by maggots? Waziri.
Through the chair, allow me to say that it would not be fair to the citizens for us to have put more money in a morgue that was too close to the MCH and was no longer very functional, and we needed to build a new mortuary. It would not be value for taxpayers' money to put more money.
I'm saying, Waziri, eh?
Yes.
Already we had a morgue existing.
Yes.
And you went ahead and demolished it before you build another one. Now, the issue of punishing people when they are alive and dead, currently, Waziri, to all families that maybe they cannot afford to put their bodies in the private morgues around Kapsabet. They need to transfer the bodies to Nandi Hills. Isn't it that a punishment? And we had already a morgue existing.
Chair.
I thought was here improper planning. You have to establish the new one so that when that one is ready, you now go ahead and demolish the old one.
Chair, point of information,
Yeah.
Chair. You are mentioning Nandi's morgue. That is the hell. It's not a morgue. And I can confidently say it's a hell. Out of 30 machines, there are only 4 machines operating optimally. I bring to the attention of the 2 seated officials, not once, not twice, more than 3 times. That is where the maggots were feasting on a dead body. So, Chair, when you say bodies are being referred to Nandi Hills, in fact, you are subjecting now death to more suffering.
Chair, still on the morgue, I don't know whether Waziri and the CEO is aware that a senior morgue mortician or morgue attendant, I don't know the right term, is now mentally deranged. I don't know whether you are aware. There was, and Waziri should be aware of this, because before the morgue was brought down, that gentleman used to work there. Currently, he is walking barefoot, carrying some sticks around town with a cup. I've met him severally. I don't know whether you are aware of his condition.
Madam Chair, I think so that we can conclude on that. I remember we sat, I'm sitting in the budgetary committee, and I am aware that we had raised the same issue when we were seated with the governor and the 2 of you. And we agree, we put 6 million for that repair at the fridge in Nandi Hills. And now, up to then, I would want to know if you have consumed the same amount.
Okay, let the CEO answer that one.
Okay, thank you, Honorable Chair. Let me say this. The morgue in Nandi Hills is not hell, as said by one member. The morgue in Nandi Hills is operational. I don't think we've been to hell and back so that we can describe Nandi Hills as hell.
Chair is making a joke out of a serious issue.
Yes.
How operational is a morgue in Nandi Hills?
Honorable.
Chair, why is the witness directing you what to do? I'm asking a question. Why are you making a joke over dead bodies in Nandi Hills?
I'm not making a joke. I'm saying it is not right to call Nandi
Is it operating optimally?
It is operating, and it
Bwana
is,
CEO,
yes, through the chair.
can you honor the question that you have been asked?
Is the morgue of Nandis operating optimally? And we can visit even now.
Yes.
You want us to confirm?
Let me say this, Chair. The machines in Nandi Hills had a defective cooling system.
Chair, you should stick to the question. Is the machines operating optimally? It's not giving stories of the machines.
Not all machines are operating optimally. Let me canvass my.
You have answered already. You have said that not all the machines.
Not all
are
machines,
operating
but
optimally.
we made a modification in the cooling system.
Modification. It was
So-
just an answer. We are satisfied.
Okay, CEO.
Yes.
The mock at Nandils, what was its capacity?
The morgue in Nandi Hills has a capacity to hold our 32 bodies.
And for now?
And for now, we did compartmentalization, or we did modification in the. It can hold the same 32 bodies, but then not all machines are. The ones which are functioning optimally are 18. And from the changes that we've made, we have not heard of any complaints. It was unfortunate and it is regrettable. I would like to say this, let us not sensationalize an unfortunate situation by calling a facility a hell.
Yeah. How are we sensationalizing an issue that was a fact in the public domain? Is the CEO taking us for a ride that this house is giving wrong information? Whereas even we brought to the attention of the governor, Chair, the witness should stick
Honorable
and
Chair.
get to know. Chair, you know, Chair, the witness
Honorable
is taking this
members,
committee. Chair, please.
let me give directions, please. Honorable CEO, I think you are going overboard.
Chair, let me say this. We acknowledge that there was...
Because you must understand that it is only this honorable house that is mandated constitutionally to carry out oversight.
True, Chair.
So whenever members are doing their oversight role, you should not actually be seen as your weaknesses so that you can improve.
Accepted, Chair. What I only request...
So I direct that from the utterances that you've just uttered, can you apologize?
Honorable Chair, let me say this.
No.
You either apologize.
If you can apologize, Honorable Chair.
Okay, let me apologize and say, Nandi smoke is not hell.
You've been using it.
To the honorable.
Okay.
Honorable Chair.
Okay, maybe Waziri, let me say this. We had 15 million.
40.
Yeah, that's what I wanted to highlight, Honorable Chair. This is what I have.
How much?
It's 14 million. 14 million.
Okay, now 14 million, Waziri. And the financial year has just lapsed. We are even in the second quarter of another financial year, and there are no plans to construct a public morgue in Kapsabet. What actually, can you give reasons to the failure of not procuring the construction of the Kapsabet morgue?
Okay. Thank you so much. Through the chair, to the entire house and to our citizens, I say that as a department, we are committed. We will be
audibility,
and
voice.
And to the honorable members and to our community, I will say as a department, we are committed. In our supplementary, one of our priorities is to construct immediately. We had plans to construct and equip consequently, but based on the availabilities and the budget cuts, we were caught in a situation. And we are also committed through the brainstorming within the department to also get a container for the criminal bodies that sometimes cause a lot of issues, just like
Honorable
the
Chair.
one that MTRH has.
Honorable Chair, kindly.
And also to
Honorable Chair.
one of the rooms
Yes.
to be a cold
Could
room.
the witness tell us the money we appropriated 14 million? Could she just explain to us what happened? You had 14 million. What happened?
The bill of quantities are ready, and as a department.
You had 14 million for the entire last financial year. What happened? Honorable, CEC, what happened? What happened?
And also, Chair, maybe the CEC can explain to us what he means by criminal bodies. Did I not hear that right?
Of course, bodies cannot be criminal, maybe. CEC, just tell us what happened to, why didn't you begin the construction last year?
Through the chair, allow me to answer both questions. Number one, we sometimes get bodies that are picked in the river or in the roadside or decomposing somewhere that are brought that needs to have a postmortem.
Unknown.
And also some unknown bodies where we are still waiting for the loved members to come looking for their loved ones. We are not allowed to dispose them off. It goes through a court process. We have to seek the permission from the court, and some time has to lapse so that we can dispose them.
Okay, for clarity, Waziri.
Yes.
Is it professional to say they are criminal bodies?
They are under investigation.
But the term you used,
Waziri,
you said criminal bodies. I think that is the term
I'm sorry to say that. I will withdraw that statement. What I meant is they are going through, there is a criminal investigation ongoing on what could have happened to the person. They are maybe unknown, they could have been murdered. And as a county with the public health officers, there is a court process. Just the same way we also have a court process for the exhumations.
Now, I think the member is satisfied with the explanation.
Thank you so much.
So maybe, Waziri, I will
to
invite you to answer the question of what...
Yes, Chair.
Yes.
There is the question on a staff, a former staff who is now mentally deranged.
Okay.
Okay, thank you so much. One of my concerns in the welfare of our staff, and it's not just healthcare workers, but one of the issues we've been grappling with is mental health, not just in healthcare staff. There are teachers, there are police officers, there are lawyers that go through that. I personally am very passionate about seeking mental health. I do talk to the people who are in the morgue. I do talk
Honorable
to
Chair,
our
we do not
people
have
who
time.
provide
Honorable Chair,
mental
please.
health to seek counseling. And when
Honorable
you
Chair.
ask
Chair, we are not discussing teachers who are mentally sick. It is a specific question that...
Was that mortician your staff?
Surely.
Was he?
I think everybody needs access to mental health care, and everyone...
Honorable members, order, please.
Point of order, Chair. Point of order.
Honorable members, let us be orderly, please.
Point of order, Chair.
Thank you so
What
much.
is the point of order,
Chair. Chair, can you manage time? We are now almost to midnight. So please, let's go to the main issues now.
Okay.
Let's forget about the dispensaries. Because the dispensaries, all the problems appear the same. Let's go to the main one.
I think this was the last issue to do with the constructions and the facilities, and that is why we are at the Kapsabet morgue that was allocated 14 million, and Waziri is trying to explain why they did not consume the same amount, and now that we have a crisis concerning the same.
We can still give them time. This is the main issue. We cannot hurry up, so we can still have time. They can still come back.
Okay.
Yes.
So maybe, Waziri, can you wind up on the mock and then we proceed?
Thank you, Honorable Chair. Concerning the staff that Honorable Mospe has said or has informed us, we would like to seek more information. And if true is our staff, we have a psychiatrist amongst our staff, and we will be able to assist accordingly. It's understandable that working environment can be traumatizing, and so it is possible. We just need to know more information. On the mock, why we did not procure, we had developed the BQs, everything else, until that point that we want to procure, and we need to agree on the siting. We need to move the dump site from the current place so that we can plan the siting. Let me say this is cutting across department. We are in talks with the administration, and we commit that we will be able to build within the next 3 months once the supplementary is passed.
Honorable Chair, so the money, was it reserved?
I've said
the 14 million, where is it?
I've said once supplementary is passed.
I'm asking you, Chief.
Yes.
Where is the 14 million?
The 14 million was cut through the ceiling, so it was
Which
not carried
ceiling?
Yes. The ceiling that each department was given, we did not carry over any unawarded project. So we are seeking...
In a nutshell, if you were to look at the PFM Act, you allowed it to lapse. You, the authorized officer, knowing very well that the Nandis are suffering, you allowed 14 million to lapse, and then you reallocated it to something else. Is it true? Is it not true?
It is not true, Honorable Chair.
What happened to the money?
We reallocated. It is not true.
What happened to the money? Where is it?
The money was...
Or it did not come from Nairobi? Are you suggesting that this budget, 23-24, some of it is still pending in Nairobi? Or it came in its entirety?
I cannot confirm that it came in its entirety, but what I can confirm,
Chair.
Honorable Chair.
Okay,
honorable members.
Point of information, Chair.
Yes.
Do we have any pending disbursement for the last for 2023-2024?
I cannot confirm because
and you are an accounting officer. And Chair,
when disbursements are done,
sorry,
they are
Chair,
not done to the
Chair, you
account
should
of-
listen.
Honorable members,
Chair, you should
please.
listen.
Yes.
You should listen. You know, he's an accounting officer, and I'm shocked, Chair. The money was budgeted for. He had no idea where to put up the structure, or rather the morgue. He's trying now to go for feasibility study when the money is now hot air. It cannot be traced, surely.
Chair. Through Chair.
Okay, honorable
Through Chair,
members, honorable members, let me
Chair,
direct
through
that.
Chair, my last question to CEO. The budgeted amount, he has said it was reallocated. Who authorizes the reallocation, Chair, without the consent of the Honorable House?
Honorable Chair, I did not say it was reallocated. I said...
It is in the record, Honorable Chair.
Honorable
Allow me to
members,
complete.
please be patient to be answered.
The witness is misleading.
No,
this House.
you know, and that is the problem. And Wanasio, it is on record that you said the amount was reallocated.
I've
And
said
now
the
you
money
are
was not
contradicting.
carried over to this financial year because the time lapsed, and so any project that was not awarded, we could not carry out as...
And what happens to the money?
The money we are seeking it through the supplementary. We will be
budgeted. Maybe even the CEC can tell us. She sits in the SEC. What happens to the money that was this house appropriated? It is only, are you saying it never came?
Thank you so much to the honorable members of the House. I think not just the health department, but others may have projects that...
We are discussing healthy.
Perhaps. I'm just giving an
Mrs. Waziri, can you stick to healthy
Honorable
department?
members.
Yes.
Healthy department.
Waziri.
Yes.
To be fair on you,
Yes.
please stick to the question.
Yes. What I
So
am
what
saying-
happened
I-
to the
what-
money?
What I am saying is that was in the budget, and when we look at the 2024-25 budget, from 2023-24, our health budget was cut by 350 million.
By who?
We have...
Are you not the ones who sit in the
We sit in the
executive?
cabinet, but there are so many needs from every
Just close.
department.
This is just about
Okay,
confusion.
honorable members, let us do away with that issue.
This is just about confusion in
Okay.
this house.
Maybe, honorable members, we should now proceed to... Okay, Waziri, can you can you tell us something on the personal emoluments? Okay. And before that, we had an issue to do with the pharmaceuticals.
Yes. Thank you so much to the honorable members of the House. On the personal emoluments, for the year 2022-23 and 2023-24.
Speak to the mic.
In 2022-23, it was 2.113,981,758, and we have submitted that in the documentation. And in the subsequent year is 2.411,387,724, and the payroll is domiciled in the administration department. And,
Honorable Chair, the witness cannot be heard. Can she speak to the mic?
Yes. Thank you so much, honorable members of the House. The personal emoluments, the salaries, in 2022-23 was 2.113,981,758. And in the following, and the 2023-24 is 2.411,387,724.
Honorable Chair, do you rule that we speak about the pharmaceuticals a little bit faster?
In the pharmaceuticals, I think...
I have a question before you discuss that.
Yes.
What is the policy? How do you supply pharmaceuticals and non-pharmaceuticals to our facilities? I'm referring here to at least the sub-counties and the dispensaries.
Thank you so much, the honorable member.
Do you supply? That's the question.
Of the House.
Do you supply?
We do have...
Yes or no?
We do have KEMSA supply to the last mile, to the facilities, and meds supply to the sub-county.
Purchased by who?
By the county government of Nandi.
Through which facility? Using which resources?
We have, number one, we budget through the budget, and we have the sub-counties make
Let's take the case of Kaptumo.
From the
Kaptumo. Use the Kaptumo as an example. Have you supplied drugs there? Kaptumo sub-county? Or Mosoriot?
The sub-county hospitals will sit quarterly and make budgets that are approved by the boards that will be brought to the FIF board to approve for the budgets. And
so you use FIF?
All facilities make requisitions, whether sub-county or dispensaries, from the facilities and submit them through requisitions to the department.
Maybe you are serious. A case like when we visited Chepkumia, yes. We were told the last supplies was last year, September. What can you say of such situation?
I'm aware that we had a supply that was done by KEMSA in April of this year, and there was some high volume facilities, being Chepkumia, I think, being one of those, that was supplied by KEMSA, about 20 facilities. My chief officer can emphasize on that. And on the sub-county hospitals, emergency medications must always be available, and they get their quarterly approvals through the FIF.
So are you saying we were lied to because we were told it is last year, September, when they received the medical supplies?
Yeah. Honorable Chair, let me confirm that
before you come in, yes. Chief, CC, can you confirm that for these sub-counties, you have not used GOK money to buy drugs for them? Do you supply using GOK money?
Yes. Absolutely, yes.
So when was it that you supplied Can you provide to this house, when you, this committee, when you supply to the sub-counties, proof that you are the ones who paid using county money, not FIF?
Yes, absolutely, yes. We do have a report from the chief officer because we do have the last mile distribution from KEMSA. Of course, we've had challenges with the refill rates, and at one point we had to use meds in the high volume facilities, about 20 that was supplied. And we do have that report with submissions. I will have my chief officer give the exact supply.
Where is the account for FIF? Where is it domiciled?
Okay, thank you.
Which bank?
Chair. Honorable Chair, let me...
Which bank?
Allow me to respond to your questions. So the systematic...
The bank.
Yes. So one, we supply...
The bank.
We supply...
Honorable Minor, please.
We supply drugs to all our hospitals, all the 153 facilities. For example, Nandi Hills is a sub-county hospital. They received an allocation or a disbursement from KEMSA worth 2,090,000 in April. Chepkumia, Honorable Mospe asked for Chepkumia. They received in April 15, 206,000, sorry, from KEMSA, and it was dispatched. The invoice is there.
Honorable Chair.
Yes.
This 2 million you're talking about, how much does Nandis collect in FIF per quarter?
Okay, per quarter.
Maybe you can tell us Nandi Hills, Mosoriot, and Kaptumo,
I think it's
even including all of them. Tell us how much they collect.
It is part of the questions that we... Part of
Just tell us.
Yes,
tell us now.
Allow me to tell you, Honorable Chair. Honorable. So for Nandi Hills, quarter 1 and quarter 2,
I'm more interested in Mosoriot and Kaptumo because I went there.
Okay, for quarter 1 and quarter 2, Kaptumo, they collected 2.8 million. Nandi Hills, the quarter 1 and quarter 2 of 23-24, they collected 12 million. Yes. Yes, 12.5.
And you supplied them drugs for what, 2 million?
Yes.
Out of the 12?
Okay, this, okay, let me answer you on the account. The account for
now you
FI,
come to the account.
Maybe I can take you through the
You
FI
know, let me interject.
Yes.
When a CEO, honorable member, please, can you allow the CEO to answer?
Yes. Honorable Chair, for FIF, we have two or...
We know the process.
Yes.
We know the process. Just tell us.
Honorable member, please. Proceed, CEO.
So we have two collecting accounts, Honorable Chair, for FIF, and one FIF account, the main account. So all these facilities collect, and then they sit. The collecting accounts, we forward the money to one main account, and then the main FIF board sits and distributes the money as per the act. 70% goes back to the facility for their expenditure. At the facility level, the board decides on the expenditure based on the budget that has been presented by the health management team. So in the expenditure like 12 million, they will decide to buy drugs, and majorly they buy drugs from meds, emergency drugs, and the basic drugs. So the one I shared of example of Nandis, that is the GOK money, the money that this house appropriates in terms of money for drugs. Like last year, we had a budget of 180. So part of that 180 was consumed in Nandils, the 4 million
Chair,
I gave example.
I think this one should not be left. How much did you say Nandi Hills collects in terms of FIF? How much?
12 million.
How much did this county, this house appropriate for drugs in that year?
That year, 180 million.
The last year, the other year, 2022, 2023?
2022, 2023, around 240 million.
So, but Nandi Hills collects themselves 12 million from the people.
Yes.
And you send them drugs worth how much?
I think we are not getting clearly. These 12 million, it is for their use. 12 million, you say 70% of 12 million, you get around 8 million, it is sent back to Nandi Hills. The way they spend, it is subject to the approval of the board. Yes. So
that's
A1,
fair enough. Okay.
Yes.
I understand that. Through the chair. The question is,
yes,
how much does Nandi Hills collect through FIF? Do you confirm it's 12 million?
Yes.
How much do you send back?
We send back the entire
Honorable member, please. It has been indicated that 70% is sent back.
Back to Nandi. Yes.
From rough calculation, it is 8.4 million that is sent back to Nandi Hills out of the 12 million.
Yes.
Now, the issue here was Waziri and the CEO.
Yes.
Since the inception of F5,
yes,
from the information that we have,
yes,
you have not been buying drugs to these sub-county hospitals.
Okay. Can I respond at that point?
Yes.
Yes. We've been buying, Honorable Chair.
So now, can you give us the CEO so that you don't have many interjections?
Yes.
Can you give us the breakdown?
In my submission,
Chair, and documents to that effect.
Yes.
You should have failed document to this committee on supply of drugs for Nandi Hills.
Yes.
Not even Nandi Hills alone, all the sub-county hospitals.
Yes. And in our submissions, Honorable Chair, we've been buying drugs for sub-county hospitals because this F5 alone cannot sustain hospital operations.
No, I think, Wanasio, we've understood the modalities in which the F5 operates.
So for Nandi,
so now,
yes,
what we are now asking,
yes,
is the money that has been appropriated by this Honorable House,
true,
for drugs,
yes,
cutting across the whole county.
Yes.
So, in your submission, have you broken down per hospital?
Yes.
And now, let me take you back to Chepterwoi.
Yes.
What is the allocation for Chepterwoi?
Allocation for under F5?
No.
Okay, what happens? In a budget of 180 million, we procure drugs quarterly.
Now, how much, Wanasio, and be straight to the issue so that we are running out of time. It is now 4 minutes past 11.
Yes.
And when you, instead of going straight to the question, you start beating around the bush, we might even leave here at 1. So the issue is, from that budgetary allocation, how much money in terms of drugs have you sent to Chepterwoi hospital?
Okay, I was saying we order drugs on quarterly basis, Honorable Chair. In April 2024, we delivered drugs to Chepterwoi Hospital, 417. That is from the main budget.
417 what?
417,000. For F5, they are purchasing themselves. Yes.
You, the chair, and the CEO.
Yes.
Are you a signatory to that F5 account?
Yes, I'm a signatory.
Does the law allows you to be a signatory?
Does the law, as an accounting officer, I'm just a signatory to oversight or to have a look to have a view, because whenever there is misappropriation, at some point you will tell me to account.
The question is very clear,
yes,
Wanasio.
Yes.
does the law allows you? You either answer yes or no.
PFM allows me to account for all resources under my custody.
Yeah, but on this one, signatory.
On this one, for purposes of
A yes or no, Chair.
for accountability purposes only. Yes.
Chair.
May
Chair.
I ask the CEO?
Yes.
Chair.
So there is you become a signatory only for accountability purposes.
Yes.
So it means that you are a signatory in that F5 account.
Yes, I'm
which the law does not allow for a CEO to be one of the signatories.
Honorable Chair, the way the F5 operates, once the hospitals are set and approve the expenditure of that hospital.
Chair, it is this house that approved the FIF. We know better than him. Does the law allows you to be signatories? Can you answer a yes or no? We move on, Mr. Chief Officer.
Okay. PFM allows me, the act, no.
Chair.
Yes, Honorable.
Now, actually the signatory should be him and the director. So I'm surprised that because it is an act that we, this house, created. And I remember one time they were crying that the finance have taken over. And then again, my main question is, now that you've retained 30%, what do you do with this 30%? Why should you retain this 30%? And for what purpose? For what purpose? Because we've asked you, over time, irrespective of the existence of FIF, we've been appropriating new funds. But we've not seen you buying drugs. What kind of drugs? What do you do with that money meant for drugs? And yet the facilities are using the FIF fund.
We've been buying drugs, I can confirm to you. And the 30%, the auditors pointed out that, yes, that we should reduce the 30%. The way we named, we said 10% goes to administrative and operational costs. But then the auditors pointed out that in any fund, administrative costs do not go beyond 3%. So since that time, we've tried to limit administrative costs to 3% and the 27% to support primary healthcare function.
For clarity, Bwana CEO.
Yes.
Are you going by the auditors or you are going by the act?
We follow both, Your Honorable Chair, because as per PFM, we need to comply. Yes, national law is superior to any legislation, because at some point, I will not have any excuse as an accounting officer to break the PFM law. So it is a feedback that we follow. We try to
Bwana CEO.
Yes.
If these are written laws, yes. Now where does the auditors come in?
The auditors pointed out that PFM allows you to spend 3% on administrative costs.
No, it means now, if the auditors pointed,
yes,
it means that you are not following the act. And that is why it came to the attention of the auditors.
We were following the act fully, but then once the auditors pointed out, we tried to limit.
Thank you, on CEO.
Chair, there is one observation I wish to make here.
Yes.
And it is good that he is also fairly honest. He said that it takes 27% and supports primary health. And I think this confirms what we got from the MOH in one place, that they take this amount and use it to fund the dispensaries. So is that true? Is that a true position?
And Chair, as he answers that, there is one facility within Kapsabet County Referral Hospital by the name Children's Speech Hearing Loss Organization. Are you aware of that facility within KCHR?
Come out again.
Just audiology center. Tell us about the audiology center. I think that is more straight.
Yeah, audiology center is situated in KCRH, and it's operational. This is...
Who is the owner? Through the chair.
The owner is a partner. We agreed to assist us with the audiology services. We partnered. Yes.
Chair, I have a question.
Yes.
Before the question, Honorable Chair, can the ICT team project that one, and what the services, because that radiological department has a pay bill.
Okay, maybe for clarity, is this the issue to do with the hearing loss?
Yes.
And Chair, for your information.
Waziri, when this program was rolled over, I thought it was a donation to the county government. How comes that now a private partner is running the...
Chair.
Because I was in attendance, Waziri, when that program was rolled.
Chair.
By His Excellency the Governor at the disaster office. And it was clearly made that it was a donation. So I don't know. Can you come?
And Chair, for your information, sometimes when you make payment for other services within the facility, it directly goes to the organization. We must subject to further audit, Chair.
And lest we forget, Chair, we require the bank for the FIF and the statements.
Yeah, everywhere is silent. And I think it is almost at midnight.
Now,
I'm not saying anything. I want to say something.
Yes.
I want to say something. I want to say something. Not. Oh.
It goes to the
I think, Chair, you can see. So we want to know who owns that account.
Why is it that when you make payment...
Now allow Bitok.
Clarification, Chair, I'm the one who raised.
Let us allow Honorable Bitok, and then I will give it to you.
Yes, I can see almost 70% of the problem that we found here. Since we started this meeting, I've been silent for some time, but the CEO is almost being above the law. That is a director somewhere, is a CEO, he owns an hospital, and the other one, the way all the witnesses have been speaking or answering their question, they are doing civic education to us. Majority of what we have been going through is just the learning. If they don't answer the question, yes or no, the way they are asked. So this is psychological torture that we have faced since we attended all these meetings. So the first thing, he was above the law, being director, being the CEO, and sub-county director, and also the CEO. So when you see there are some final, that there are some rulings that we are going to make on whatever we've got it here, and whatever we have, like the other one now, paying the M-Pesa. So we have been paying some things in a very different way, confirming, and the money are going to somewhere, the wrong direction. That is the comment that I want to before.
Chair, as I submit on the issue.
Yes.
We have the information, even when you pay for other services within the facility, it directly goes to that account. It is a serious fraud, and these people seated here today should tell us, before they leave this house, who is the owner of that facility. And if it was a donation to the facility, who changed the ownership and for what purpose? We can't allow fraudsters to run this county, Chair. We can't allow.
Thank you. Thank you, Honorable Member. Maybe for clarity, Waziri, I was at the function when these hearing loss equipment were handed over
Yes.
to the county government.
Yes.
And it was categorically mentioned that it was a donation. And I remember the governor saying that this is the second hearing loss equipment after the Kenyatta National. And he even went ahead and said that the equipment at Kenyatta National Hospital was not functioning. Now with the inception of this one at Kapsabet, we shall be having patients on hearing loss coming to Kapsabet. That it was only now Kenyatta National Hospital and the KCRH that was going to, what is happening? Now, the governor said that it was only Kenyatta National Hospital and the KCRH in the whole country that will offer services on hearing loss. So I'm now wondering that the donations that were given to the county government of Nandi has been turned to a private business. What do you have to say, Waziri, on this?
Thank you so much to the honorable members of the House. Allow me to say that I did sit in several meetings with the partners overseas to ensure that Nandi County got the donations. And we started this program as a free hearing screening from Chislo. Chislo was the initial partner that had the partnership overseas. And for us to get the equipment, it needed to benefit the public. And yes, it is true. I don't think there is another public facility that has an audiology center. And the equipment belongs to Nandi County. The equipment is there. We set up. Chislo were doing the free screenings with their team. As a county government, we have invested after this on speech therapy. We've sent people to go to school for that, plus audiology. And Chislo has been the partner that connected us to the overseas team, because when we started screening, we never had a place to refer these children who are vulnerable. And I did sit in a meeting and made sure that we lobbied and showed them the need. We showed them the statistics, courtesy of all the free services. They even went to the community, they went to schools, they went to the showground, and that's how we got the equipment. What I will say is, it's like also the oncology where we work with ICI. We do not have an oncologist. We have worked together.
Chair. So, honorable members, let me guide Waziri.
Yes.
Are you aware that the issue before us has been turned to a private business? Are you aware? And if you are not aware, Waziri, you just be honest that you are not aware, we proceed.
Chair, they are either aware or part of this conduit of corruption. There's no option about this, Waziri. You are either aware or part of these messes in this county.
CEO, are you aware of this?
I'm aware that audiology is supposed to offer free screening services. The only payment that the partner was seeking to is for devices.
That's a rule, we move on. Yes. We move on.
Move on. I have a question, Chair, before I forget.
Okay, it was Honorable Tarbe and then Honorable
Yeah, I heard
Bridges.
the CEO saying that 20%, 27% of the FIF money goes to primary health. I am aware of complaints from the community, is it health volunteers, health promoters, that the national government have won at their end of the bargain. When was the last time the county government paid their money, their end of the bargain for the community health promoters?
Okay, the last payment we did for community health promoters, it was in April this year. We did the payment of 5 months, I think, and we are not supporting through F5, we are supporting through the main budget. We have budgeted that amount.
The one you said now you are using the 27?
The 27% or the 20% per the Act is to support primary health care function, and the main F5 board sits and agrees on the budget on what to support at that time.
Now, if the community health promoters are part of the primary health, why are you not giving them priority? Because like you sit and decide what to use, yet there is a need to address. Yeah. What's happened?
Okay, we have 1,500. Okay, these CHPs are different program.
All the honorable members, let us consult in low tones.
CHPs are 1,000. We have 1,520 CHPs, and they are entitled to be paid 2,500 by the county government and 2,500 from national government. So we cannot support under F5 because it's a program that is being supported under the main budget. It cannot if you do your calculation, 1,520 times 2,500 in a month, it comes to how much? And then in a year, it comes to how much? So that's a different program. Expenditure of the 20% per the Act is agreed by the board, and the ministers are available in every expenditure.
What is the delay? What is causing the delay? That the national government is honoring the end of the bargain, but the county, it's kind of slow.
The delay is because of
to also add that to the
okay, I want to direct an issue here, Waziri.
Yeah.
Did you supply the delivery notes from KEMSA?
They are there. I did not supply.
So I need, I direct that you will supply.
We will supply.
And the needs delivery assessment per sub-county.
Okay.
Chair.
Latest Friday.
Okay.
At 10.
Honorable Chair, including the accounts. Which bank did you say? In which bank is the FIF? How many accounts and in which bank?
Each hospital has a spending account, and we have 2 collecting accounts and 1 main account for FIF.
So you will disclose all the accounts?
Yes.
By Friday?
Understatement.
And accompany with a bank statement, a certified bank statement to that effect.
That is in order.
Yes. And then maybe there is an issue on F5. Who is the banker? Who is the account administrator?
We have a fund administrator called Kemboy, a CPA Kemboy.
So are you aware that that F5 is being misused as the accounting officer?
I'm not aware.
Are you aware of fake receipts?
Fake receipts for payments or?
Yes.
Payment for the service?
Yes.
Yes, okay. That is not misuse of F5. It is, it's an offense that staff...
Now, I think let us leave it at that.
Let me complete my statement.
Proceed.
Chair.
Yes, Honorable
There are
Bridget.
some fake receipts and we subjected the staff in the disciplinary process. We have even interdicted some.
Chair,
yes.
The witness is very hostile. Once you've ruled, he should stop speaking to us again. Chair.
Chair, it's my turn.
Yes.
It's about fetal monitoring machine, CTG. When was it bought and where is it? Vital monitoring machine.
Echo ECG.
Vital. Vital. Fighters. CTG. CTG. CEO.
Okay, for better understanding, Mheshimiwa Bridget, yes. What is the function of this machine?
The machine is for monitoring the fetus in the tummy. Yes, it is fetal or vital. No, listen, this machine have been bought 5 times, and it is not there in the hospital. The second question, CEO, that is the direct question to CEO. How many chemists, listen, let me finish the questions and then they will answer me, because I'm tired.
Okay, proceed.
You are really stressing me. How many chemists do you own, CEO, in Nandi County?
0.
CEO?
0.
Okay. Answer the first one.
Okay.
Through proxy?
0. And I'm not saying it is wrong to own a chemist, but I don't have one.
Yeah, it is not wrong.
Yeah.
It is not wrong. I agree with you. But it is conflict of interest.
It's conflict of interest, but I have no. To open a chemist, you need to be a
Now, let us leave that one of the chemist. Can you go back to the issue raised by Honorable Bridget about the CTG machine? Yeah.
Okay, I'm not aware about the machine. What we used to monitor fetal, or we have a Doppler and also we have ultrasound. Yes, but then I'm not aware of the one that has been bought 5 times. Yes.
Maybe Waziri, she is in a better place to answer this.
Thank you to the honorable members of the House. We do have an ECG machine and an echo machine. And I'm not aware of what has been stated by our honorable member of the House.
Chair. I also have some questions, eh? Yeah. Okay, why is it that the laundry services of referral hospitals are done in Nandils?
Okay, we had a problem with the laundry machine that it broke down, and we've since started the repair works. There is a component in electricity that got broke down, and it has been, the hospital has started to repair.
Then the CEO, it has come to our attention that you are all down in the health facilities. You are the one who is transferring the staff from one end to another end. Okay, and that is the duty of the director. Is it true?
Okay, transfers is a function that we usually subject to crack. So when I sign a posting order, it has been discussed at the crack level. And at crack level, we have heads of HODs. And all these transfers are effected to ensure performance, to ensure we improve service delivery. It's not punitive as such.
Oh,
yes.
Maybe on the issue of the laundry machine.
Yes.
What is the cost? Do you transfer these the clothes to Nandils on a daily basis?
Yes, because there is high.
No.
Yes.
Answer the questions. Do you take clothes to Nandils on a daily basis?
Yes. Nandils and Mosoriat, we split.
What is the cost of taking it and bringing it back?
I cannot confirm the cost.
And do you pay those hospitals?
Okay, just a little. Now, you use the county vehicle.
Yes.
You use the county vehicle.
Yes.
Which vehicle?
Sometimes we use an ambulance, sometimes we use a utility vehicle. Yeah.
Okay.
Chair.
Now I was heading somewhere. Now, yes. You use an ambulance on a daily basis. Okay? What amount of fuel does the vehicle consumes?
When we have fuel an ambulance with around 50 liters, it can serve us, depending on the location.
I just want to do some arithmetic here.
Yes.
For the ambulance to go to Nandils and back, how many liters of fuel does it consume?
I say 10 liters.
So per day you use 1,700. Okay?
Yes.
For how long have you been taking the clothes to Nandils?
Okay, we don't take daily.
No. For how long? For how long? When did the machine broke down?
Around 2 weeks now. And repair works are ongoing.
What was the quote? What was the quote for the repair of the machine?
I cannot confirm the quote because it's the hospital that have engaged a person to repair and F5.
No, Ziri. Bonasio.
Yes.
You are the accounting officer for that department.
I can confirm. I can find out.
Honorable Chair.
Maybe a question.
Kindly, just to ask the accounting officer, what is the work of an ambulance?
Yes, the basic,
sincerely speaking,
the basic work
of the
basic priority work of an ambulance.
Is it to carry clothes to Mosoriat and Nandils?
And Chair, as he answers that, Chair, there is another important question. This man here by the name Fred Kiptum, who is the CEO for Health, has assigned a nurse to manage ambulances in this county. Could he agree or deny? Why did you assign a nurse to manage the ambulances?
Okay, Thank you. I can confirm confidently that I assigned a nurse, and the reason to that is that when we are doing referrals, it is the nurse calling for ambulance. When we are doing a referral for a level two or stage 2 delivery, the nurse calls the coordinator and tells this is a case of breech delivery, this is a case or in stage 2 delivery, so we need an ambulance. So it is ideal and it is a technical decision which so far has yielded fruits. We have no, we've seen efficiency in management of ambulance in terms of referrals and attaining the goals of saving lives through ambulance.
Chair, as per the policies, who should be managing those ambulances?
It is the nurse. Okay, as of now, we are not yet through with the policy, but this thing has worked. We cannot.
No, I'm just asking. I'm not asking whether it's working or not.
Yes.
Before your initiative to assign a nurse,
yes,
who was in charge of this?
He was a paramedic, and we had a lot of problems. Imagine a nurse calling a paramedic who doesn't have medical background and explaining a case. You see, when you explain a case to a nurse that this patient has complicated at this stage of delivery.
Chair, it's lying to this. What is the association? What is your association with that specific nurse? What is your personal association with that specific nurse that is managing the Nini? What is your personal association?
I found him managing when I joined the.
I'm just asking, what is your personal relationship or rather association with that specific nurse who is running the ambulances?
Okay, honorable members.
Chair.
Honorable members, let me protect the witness.
There is something very critical,
but
Chairman.
the CEO has not answered.
Yes.
As a paramedic now, because he's a paramedic, what is the function of the ambulance?
Yes, in fact, Chair, we have been running a site when we see an ambulance with siren to make the matters what is the clothes carrying, Honorable Chair.
Honorable Chair.
It is so hilarious.
Chair, as I asked that question, we saw in social media the other day an ambulance without the glasses, and while I was going home, I met an ambulance towing another ambulance. So, you know, I am wondering, maybe they can explain the role of the ambulance.
Honorable Chair, as they do that, there is something that I think it's a bit critical. He mentions paramedics. And I would like to probably inform this committee and ask from them. When we were in Mosoriot, the information we got is that the vitals, the triage, is done by paramedics. He claims that since paramedics do not have medical background, they cannot run an ambulance. Do you have a medical background?
Yes, I'm a microbiologist.
Medical background, I asked.
Yes.
So you are better than a paramedic?
In my field, yes.
Okay.
In microbiology, I'm excellent than a paramedic.
The question of an
okay. Honorable members, let me take back the CO. How many ambulances are functional?
As of now, we have around 10 or 12 which are functional. One got an accident and it is in carriage, or four are in carriage.
Chair.
Now, can we run? There was a video showing a grounded ambulance.
Yes, that's what we wanted to find out. In Akko town.
Bwana CEO and the CC, there is an issue on patient negligence. Has it been brought to your attention?
Is that the one that was presented in the Honorable House?
Yes?
Is it the case of the child that was presented in the Honorable House?
No.
To the honorable members of the House, I will say that anytime I get any information from a family member, from a patient, I do send my team, or actually sometimes I go personally to investigate, and no negligence should happen to anybody's family member.
Okay, the ICT team, please, can you project the ambulance?
And also through the chair, maybe the ICT team to project the audiology equipment.
As we wait, Chair, as we wait for projection, do we have our ambulance that it is in Gota or Eldoret?
Go down.
Yes, it is packed in a place, go down up there, where it used to be Kenit.
Okay, that's not the go down. That is a supply or maintenance called right tires. We had an ambulance which was repaired, but then we are yet to pay.
How many number?
We have one ambulance, yes, one ambulance and one service vehicle. It's not a go down, it is, the right tires is one of our maintenance suppliers.
Maybe so that I can conclude on that question, Chair, how long have they been there?
Around, it should be around 6 months now.
Okay, on that, Waziri, yes. In the department, do you have hired vehicles?
Chair, point of information, and it is very urgent, eh?
Yes.
It is a matter of urgency. We have our internal sources, for the machine alleged it is in the KCHR. It is something suspicious. The machine wanted to be sneaked out right now. So kindly order that the place should be secured. The hearing machine. There is a guy called Steve, and I think you should give orders so that the machine and the surgeon at arm to take care and to secure the site at the KCHR immediately.
The machine belongs to the Nandi County.
Chair, I say this is a conduit of corruption.
Can the surgeon at arm confirm the information?
Yes. We cannot take it for granted. We cannot assume.
Hey.
House through the chair.
I think, Chair, you can stop the other discussion and take the matter seriously.
Vehicles? Not that I know of.
How safe is the site, Honorable Chair?
Thank you. Okay. Maybe now we need the projection of the ambulance that is in the yard. How many vehicles, Bwana CEO, how many vehicles do you have in your department?
Ambulance, they're supposed to be 16. We have utility vehicles.
Supposed to be 16. Can he be
ambulance
specific?
16.
Now, out of the 16,
yes,
you've said 12 are
12
operational.
Are operational.
Where are the 4?
They are in garage.
For how long have they been in the garage?
Chair, and which garage is it?
One got an accident around 2 months ago in Jepsangur, and it is in Chinese garage. The other one is in right tires. There is one in Eldo Auto Garage. In fact, two in Eldo Auto Garage.
Now, I want to, the CEO.
Yes.
Are you conversant with the Public Officers Ethics Act? You are conversant?
Yes.
What does it state?
I can refer public ethics.
No, I don't want you to refer. You said you are conversant. So you don't have to say you are conversant and then you want to refer. It is either no or yes, so that I will, if no, I now allow you to refer.
Okay.
So are you conversant?
Maybe the farthest I can go is that the Public Ethics Act, we need to conduct yourself with integrity and something like that.
What does it talk about public property? Are you conversant with that section?
Maybe you can make me aware.
No, I want to confirm first.
Yes.
Yes or no?
No.
No.
Yes.
Now, the section is very clear.
Yes.
That you must, by all means, protect the public property.
True.
So, this issue of the vehicles being in this garage, are they safe?
They are safe, Honorable Chair, because we signed.
And now I'm worried. If an ambulance have stayed in a garage yard for 6 months, Waziri, what are the reasons?
Let's move on, Honorable Chair.
Chair. Honorable members of the House, I know the...
Yes, meanwhile, as
Chair, they have no idea. Just move on. We shall make our own observation and recommendation.
Okay, honorable members, I was requesting the ICT team to project a vehicle, an ambulance that was spotted in a certain garage.
As they are projecting through the honorable member of the House, we have had incidences where we had an ambulance that is ready to be brought, and because of delayed payments, the chief officer has actually intervened to go to the garages and talk to them. And I think 3 years ago I had the same incident.
Honorable Chair.
And
Honorable Chair, so that she doesn't mislead us.
Yes.
Could I request, are you conversant with the Constitution? Maybe you can start there. Article 179. Are you conversant with it? 179.1. Please just answer me. Are you conversant with it?
Allow me to refer, please.
Just answer first. Witness.
Just leave it.
Through the chair.
Waziri, you know these things are straightforward.
No, you asked me about...
Maybe you are conversant, but to some reasons, maybe you cannot recall the exact contents.
Yes.
So do you know, are you conversant with it?
That, to the honorable member of the House.
Just to the chair.
Okay.
I may not remember.
Maybe, Waziri, I will allow you to refer.
Thank you.
You refer to Article 179 of the Constitution.
Okay, refer to it then and read it to us, 179.1.
Now, where is the Waziri?
He has it. He's looking for it.
Where is the...
Did you find it?
Shika. There is no... Okay, Waziri, maybe...
I have it. 179.
Just read it out.
If the executive authority.
Please read loudly.
The executive authority of the county is vested and exercised by the county executive member.
Does it say member?
Yes.
There's a place where it says member.
And exercised by a county executive committee.
Okay, and are you a member of that body?
Yes, sir.
Okay, could you then read also 183 C, 1C? And maybe you can read the title first, then go to 1C.
Functions of the county executive committees.
No, just read clearly.
The county executive shall, you said 1C, manage and coordinate the functions of the county.
Please read clearly, witness. The title?
Functions of the county executive committees.
Committees?
Yes,
Oh, yes, okay, yeah.
County executive committee shall
was
manage and
it to
coordinate
read?
the functions of the county administration and its departments. Yes, I am versant with that.
So this question that is being asked, and you are even trying to pass the buck, and say there is this delay, there is that problem. Do you see whose function it is?
Honorable member of the House.
Not
there is
just refer to the
collective
chair.
Responsibility, and I.
Do you
was
see whose
saying
responsibility it
It
is?
is my responsibility, and I have called before
Thank you.
to follow up. I've even called a mechanic.
The
and
witness
told
is
him
shouting.
that this
Okay, thank you, Waziri.
equipment
You've
is
answered
needed.
the question.
Yeah.
Yeah.
I have actually
So,
called personally.
do we have the photographs? And if they are not there, we proceed to the next item. We still have an issue to do with personal emoluments, or we reschedule.
Yes, let us reschedule.
We reschedule, Waziri.
Let's finish. I have a lot of time. Excuse me.
Why don't we, honorable member, why don't?
Please.
We will not do justice. There is so much. You know, 2 billion, over 2 billion of county funds.
Let us defer, Chair.
Are paid to ghost workers in this department, and the medics are not paid. The real medics.
Okay, honorable members, I have heard your request. Now that it is even becoming, it is 7 minutes to midnight. 7 minutes to midnight.
Chair.
I will request
Chair,
that
Chair,
we adjourn the session.
Chair, before you adjourn, there was this name called Steve. There was that name called Steve Kitur. It could be in Regot. Who is this person? Do you have somebody by the name Steve Kitur in your department?
Waziri?
They know. They know. The silence speaks, Honorable Chair.
Yes,
Through the chair, Steve Kitur is one of the partners with Chislo. But if there is another Steve Kitur,
Thank you.
If there is another Steve Kitur in the department that a name coincides, I do not know if there is.
Okay, thank you, Waziri.
Okay.
So, honorable members, I think all the concerns have been answered. And any other pending issues, I will request that we shall handle it with the issue of personal emoluments. And maybe we had the pictorials of the function, Waziri, that we attended. Can we listen to that audio?
Abunu lesosi, ako yen kokebwa yu, sait betusiek aeng amakinyoru kanyoiset eng sipitali nebo Kapsabet. Nguni kemite yu, manyor daktari. Kimite ak mgonjwa, inendet nekoketeshi oxygen for 1 week. Amamie mabadiliko age tugul. Nguni kakisame kotoretech. Akoi sai mami ole awendi amu matinye kiy age tugul. Mami chakonyo eng private. Kokisame toretet. Nitok ni kimite nguni, ami kora kikemboi akami anegei. Wasame toretet kaikai otoretech. Amu kakoyait Kapsabet, mi oxygen, my sister, ako sai kotom konyor kerichek alak tugul.
We wanted to justify Waziri that the equipments for the hearing loss was a donation, and we have there are some photographs that were taken during the launch. So you confirm, Waziri, that they were donations?
Yes, I do.
Okay.
Because I sat in the meetings when we lobbied to get the equipment.
Okay, honorable members,
maybe it will be good also, Honorable Chair,
yes,
that all the donations, when we were going around, could the chief officer also declare all the donations, even in terms of the generators and all that? We are about to adjourn, but
now,
when you
those are
come.
the Waziri, I think if you can remember, that is the time when the governor launched
23rd November.
the hearing loss equipments. Who is he? Steve Ki? Is he among the group? Is in the man with
In the red tie.
Yeah.
No, it's the stripped tie next to the chief officer. And there is another gentleman behind him.
Thank you. So otherwise, maybe Waziri, you will give your, that is the ambulance that is.
So, thank you, Chair. Chair, maybe one last remark. So for how long? You see, we had asked Waziri the other time, and he has really given us the math that he has done to convince these people to resume back to the service. So what is the way forward? Maybe we give him to explain for us 2 minutes. What are the measures that are at now, or we are still
by the way, let me inform this
How long will this hospital be closed?
Thank you so much.
May I inform this committee that they went to court?
I have an answer.
Let us have order.
There is a court order already.
No.
Sought by them.
Yes.
And so I don't think they are being really truthful. They say they care, but they are not willing to discuss.
Chair, one more important thing, Chair, please. Something very important, we close with it. Trauma Center in Nandi Hills. In their reports, they have indicated it's operational and the money was allocated, whereas it is not operational. In a second, can the CC tell us?
Thank you so much. I do care about my healthcare workforce. I am a healthcare provider before I am a leader. And I have stepped in before to assist in the department. I will say that what we are doing is, of course, whenever there is an industrial action, there has to be unity amongst the workers. And I thought it was the best way we could do to get them back to work. Because all these decisions, we have talked with them, we have communicated, we don't want to lose any lives. It has happened in other counties, and in the 7 years that we have enjoyed without having this is one of the lowest times. And the goodwill that we have, we just need a little bit more resources and we will meet based on the different strategies that we have decided to do within our means. Thank you.
Okay, thank you, Waziri. I want to thank Waziri and the CEO for the session and all the honorable members, plus the secretariat. Maybe now I will call upon the proposer and the seconder so that we adjourn the session.
I, Isaiah Minor, propose.
Thank
I, Bridget Songok, do second.
Thank you, Honorable Bridget. The session stands adjourned. Waziri, you will be communicated when we shall come and have the item on personal emoluments. We shall communicate before Friday. Otherwise, the Sergeant at Arms, Asha Waziri and the CEO out.